All right. Well, I don't have a gavel, so I can't bang us into a into motion or into session. But thank you very much for this coming to this regular session of the West Ada School Board. Please join us as we stand for the Pledge of Allegiance. Thank you. So thank you so much for your patience. This evening, we're going to start off with a spotlight, and it's a presentation of the draft audit, and Mr. Jonathan Gillen will be presenting. So, Mr. Gillen, you have the floor.
Chairman, trustees, Dr. Reynolds, thank you for the opportunity to present. I wanted to start before we bring our partners and Bailey, our auditors, up to talk. I wanted to give you a little bit of context for what we're going to cover during the spotlight this evening. So we're going to talk about two items. We're going to start with our audit process. So we're going to give you an update on the draft of the audit. We're going to share a little bit about how the audit went. We're going to give you some information about any concerns that were shared, along with walking through the financial statements. You're going to notice it's a slightly different process than we've done in the past. And so at least from last year and the year before, we brought you an audit that was essentially already done. It had been agreed to, and kind of to not bore you too much, but give you some information on how the audit process works. Once it's finalized, essentially the auditors go to issue the report, and then the language is kind of captured and done, and it's solved, and we're done, and we close the book on that audit. So what we wanted to be able to do was to give you an opportunity to ask questions. It's still in a draft format. I use that term draft lightly. It has been reviewed very thoroughly by our office and by internal control folks and all the partner review that happens at Bailey. So essentially, it's ready to go, but this will give you an opportunity to ask some questions and have involvement in that process. And then ideally, it'll come back for approval on the next board meeting. And so that'll be the process we're going to walk through. I will introduce Kristen Diggs in a second. She'll come up and share a little about the audit. She has a PowerPoint presentation she's going to walk through. But I did just want to take a moment and say thank you to a load of finance staff. So Brian Smith, who's our controller, sitting way in the back there, he is critical, instrumental in this process getting done. So this audit was done a couple weeks ahead of schedule. In my opinion, it was done quite well, and I think we did a great job. So a lot of that credit goes to Brian. But it's not just him. So all of the finance staff, all of the HR staff, all of the payroll staff have a piece of this audit. And to put that in perspective, this process for us starts in July and runs all the way through. We're still doing it now. In addition, the finance staff are working on drafting a budget book. You're going to get a copy of that in a couple weeks, along with we're going to talk budget in just a little bit. So a huge thank you to them and all their hard work. And now I'm going to turn it on over to Kristen. Thank you.
Thank you. Hopefully I'm loud enough, but if I'm not, just tell me to crank it up. Yeah, I'm short. Like Jonathan said, my name is Kristen Diggs. I am the partner on the district audit. I have been the partner on the audit for about 3 years. Before that, I was a manager for a couple of years, and then rotated in, prior to that. So I have been with you guys for a while, but like Jonathan said, we did start this process. We actually started the process in June. So we came out and did federal fund testing. So you guys receive federal funds from the U.S. government. And so one of the programs that we looked at this year was over the school lunch program. We looked at that starting in June, and then we come back out for 2 weeks in August, and we wrap up the process. So it is a long, drawn-out process, and with everything going on this year, to add an extra element to it, it was a remote audit. So both to protect the district staff and to protect our staff at Bailey, we did do a majority of the audit remotely. So that involved a lot of Teams calls, a lot of screen sharing, and like Jonathan said, it's a huge amount of undertaking by the finance staff, and I'd like to also say thank you, because without them being able to work with us in the remote environment, we wouldn't be able to issue this financial statement essentially a month ahead of what we did last year. So I really want to say thank you. Appreciate all the help with it. With that, I kind of talked about the fact that we started the process in June. We go through and we do a planning process, and we also go through and do a risk assessment process. Obviously, the coronavirus and everything associated with it did go into our planning process, but we do walkthroughs over your significant processes, such as your cash receipts, your cash disbursements, payroll, and we just get an understanding of the processes. One of the things that we did look at this year is, were there any differences in the control structure from when everything went somewhat remote or fully remote to what the processes were before, and were there any breakdowns? We didn't come across any, but that is something that we looked at because the control environment did change because work situations changed. So that is something that we did look at. As part of the audit, we come in and we do testing over the different balances on both your statement of financial position as well as your statement of activities. We're testing your major revenue streams. We pull samples of items and test it and just get an understanding of your overall revenue and expenses and make sure they make sense. So the financial packet that you have, it's about 70 pages, but it's broken out into several different sections. So there are 3 opinions that are issued as part of the financial statements. There's an opinion over the financial statements themselves. So you'll see that starting on page 1. And then there's the opinion on internal controls, and if we had any issues that came up as, based upon our walkthroughs, significant audit adjustments, anything like that. And then we give a 3rd opinion over compliance with your federal funds. Okay, and those are towards the back of your report. Another component of the financial statements that you'll see in here is management's discussion analysis. So this is management's opportunity to talk about what happened during the year, as well as there's an economic outlook section at the end of the MD&A that talks about, okay, this is what we know for the district going forward. And so it kind of takes out the accounting side of it and makes it to where you can actually understand what took place during the year, what the big changes were and everything like that. So as far as the rest of the financial statements go, we do have the government-wide financial statements that are next. So essentially what that does is takes everything at your fund level and consolidates it and brings on your assets and your fixed assets, your pension liabilities, your long-term debt that you're not seeing at the fund level on the balance sheet. And then we have the fund financial statements, footnotes, required supplementary information, so your budget to actual schedules, required supplementary information associated with the pension footnote, OPEB, all of that. And then we have your ASB information that's included in the other financial information. And then we have the single audit summary. The summary of results of the audit, you'll see on page 68 of the audit report. And so this is a schedule of findings and question costs. And basically says a high-level summary. We were able to issue an unmodified opinion, which you'll see on pages 1 through 3. We issued an unmodified opinion on internal controls and compliance. So we didn't have any issues in any kind of breakdown in internal controls. And then we did issue an unmodified opinion on the single audit. One of the things you'll see kind of down a little ways is with the child nutrition single audit that we did look at, we did have one finding associated with cash management. When everything went remote, there was just one small item, and because we're required to report it, we were required to give a finding on it. We didn't have any adjusting journal entries as a result of the audit process. We did have 3 past entries. So these were ones that management determined that weren't material, and so they weren't made. And so this graph just kind of gives you a high-level picture for the past 7 years. Basically, your comparison of your revenues and expenditures year over year. This is the 7th year that you guys have been able to have higher revenues than you have expenditures, which speaks to the management of the district. One of the things you will notice on this slide, and I believe Jonathan's going to cover this a little bit later in his presentation, is the gray piece is the expenditures. And you will see that the ending fund balance you were able to add to it this year. And part of that's due to timing because there were cost savings essentially associated with schools shutting down and everything. But obviously there's other costs that were incurred subsequent to year end. So. And then part of the reason too you're adding to your fund balance a little bit with the increase in state funding and everything is because the enrollment numbers are increasing. So this kind of gives you a picture of where the enrollment is year over year, and I believe this year it was about a 2% increase. So, and with that, do you guys have any questions?
Any questions from trustees? Ms. Diggs, I actually had one question concerning COVID and the fact that we're online. Did you, in terms of just process, did you find any changes in how we're doing? Is our process solid for being online most of the time?
Yeah, we didn't see any issues that concerned us at all when you went. It seemed like there was proper segregation of duties and that there were adequate controls where there needed to be. So nothing came that causes concern came up.
Excellent. Yeah, thank you. Trustee Johnson.
Thank you, Mr. Chair. I may have missed being able to get the 80-page report, so I read this document, but I haven't seen that yet. Could you just summarize the recommendations or some of the key ones in there?
So there was only one finding on the report, and you're referring to this, right? Okay. So in the back of the report, there in the schedule of findings and question costs, there was a finding associated with cash management on the school lunch program. And basically, there was a small amount of money that was incorrectly asked for from the state. And so they've put in a process and everything to fix it going forward, and they've already fixed it with the state. So basically, just make sure you have a control to catch it.
Excellent. Thank you very much, Ms. Diggs.
Mm-hmm.
Thank you so much. That then brings us to the second item, which is a budget update. And again, Mr. Gillen will lead the floor.
Chairman, trustees, Dr. Reynolds, thank you. Many of the things that we briefly talked about during the audit process, in particular fund balance, we're going to discuss again here. So hopefully we'll be able to kind of build our learning and come together. So what are we going to cover during our budget agenda? We're going to talk a little bit about fund balance. We're going to talk about enrollment and how it's looking for this year and the impacts of our reduced enrollment. We're going to spend a little bit of time talking about CARES Act funding, and then we're going to have some discussions of what that means and what are our next steps in the process. So like we heard, our fund balance went up. And so if you remember when we had our multiple and many budget meetings, we talked about a budget number that we anticipated fund balance was going to go up. We had talked about savings that were generated. We had talked about some expenses that we were going to put into fund balance, like transportation. So this number was already, we were estimating between 35 and 36 million. The number was a little higher, right? We're talking $3 million more. We're sitting around 39 million. So what caused the difference? How come it went up more? There's some very specific things. So we had extra revenues in transportation, roughly $700,000 more than I anticipated when we kind of built that budget. And again, that calculation sometimes will change in May and a little later on. So we're always kind of monitoring that, but it ended up to the better, which helped us with our revenue side. When the state averaged our ADA, so if you remember when we talked about ADA and essentially they were going to do an average of that, we typically will have a reduction in our support units during the year. So we'll be high in our numbers in October and November, and then over time for the best 28 weeks calculation, student enrollment will fall and our support units will fall. And we budget and plan for that. So when we built our budget and planned for that, we planned for a reduction. Fortunately, that reduction, because of the averaging, wasn't as big as we thought it was going to be. And so that was roughly another $600,000 that we were able to recoup. So those were dollars we weren't anticipating. Tax adjustments came in a little bit higher than anticipated. You always have some dollars that you receive from a previous year that roll into this year based on liens and payments. We had a couple more savings in transportation than we anticipated. Workers' compensation, I tried to guess how it would look in a COVID environment, and I guessed a little bit more conservative than I needed to. And so we generated some additional savings there. And then if you remember, during a lot of our budget conversations and the budget we changes toward the end was because the supplemental levy had not passed. And so obviously we were in a very conservative mode. We were looking to look at costs and try to save dollars wherever we could because we knew of the potential for loss of fund balance. And so that impact obviously was felt as well. So what does it look like? We have some additional fund balance, and now we're going to talk about how we're probably going to use some of those dollars. So let's go on to the next slide. I'm going to do that for you. So our loss of enrollment, right now we're sitting at approximately 2,200 students. When I ran the numbers this morning, it was slightly higher, 2,247. But we're in the ballpark with the calculations that I've done. And so that's going to impact a couple of things associated with the general fund. We're going to talk about a loss in discretionary funding. We're going to talk about a loss in salary-based apportionment. And so those are our two major funding streams. There is also some other losses associated with enrollment. It will have an impact on transportation, not only mostly because of the way the block grant calculation works. We anticipate a loss in funding, and then we have some other areas where we'll have an impact. So we're anticipating a loss of roughly 75 support units. And so that's the full loss. What we're going to talk about in the next slide, we spent some time talking about what does protection look like. If you remember, we kind of had a discussion of, hey, there's that 3%, and then protection starts to kick in. And additionally, we're also going to talk in the next slide, we're going to talk about how the enrollment calculation is different. So we've been working in an ADA model, and this year we're changing to enrollment. And so there's some changes with that calculation that we still don't know all the answers to. And so those are still some question marks we have. With the loss of discretionary funding and salary-based apportionment, if we lose everything associated with all those support units, it's going to be a $7.9 million loss. We're going to have another $1.2 million in those other funding areas, which are talking about transportation. There was roughly $370,000 additional I thought we could have with the loss of enrollment. That calculation is heavily contingent on what everybody else is doing and the expenses we incur. So it's a little difficult to get at what that calculation will be right now, but I think in a conservative approach is we should assume that it will go down a little bit. Transfers in. We do have some areas that make transfers into the general fund, in particular TK. We looked at our differences in our tuition rates for TK based on what color we were in. So that impact will have on the ability of them to transfer dollars back to the general fund. So essentially, lost revenues will now impact lost revenues in the general fund. And then we have two special revenue funds, counseling specifically. They're going to receive almost all of their dollars associated with providing career advising is in staff. And so our expectation was with the loss of enrollment, they will have a reduction in funding. And so we essentially pushed that loss in funding over to the general fund to be able to help keep that department and their services whole. It's much the same thing with IT. So they have two areas where they're going to receive reductions in funding. It's IT staffing and their IT allocation, both of them which will receive a reduction. The IT staffing does have fund balance, and we feel like right now we're going to be able to mitigate that and work through the year. The IT allocation, just because we are operating in an online environment and we want to make sure that we have the resources available for Devon, we just planned for the fact that there could be a general fund balance impact, and so I've calculated what that number is, and we'll continue to monitor our budget and use it effectively. So what are the things we don't know yet about the calculation? So as I said, we talked about protection. Last year in June, I talked about a number of around 6.2 million was when the protection would start kicking in. We'd have our 3% hit that we're going to pay for, and then after that, essentially there is a self-paid-in insurance pool. All of us pay in, and all of us get some dollars out. And in a normal non-COVID year, I could tell you how that calculation is going to work. There's going to be some districts who are going to have increases in enrollment. Everybody's going to pay in some numbers, and we'll be able to utilize that protection. In a COVID environment, there's a lot of districts who are having losses in enrollment, and so that means a lot more people are using that protection. And we don't really know how that's going to work. And part of the problem with that is the calculation's not usually finalized until February. And so as we kind of look at what it looks like and we try to figure out how that is, and then we try to figure out, well, what is everybody else losing around us? What are the districts around us? What are our districts around the state? What is the impact of their losses potentially on funding, and how much we have to pay in to our own loss that we're going to get out? And so those are just numbers we just don't know yet, and we won't know them for quite a while. And so essentially the calculations I've been running is, let's assume protection doesn't help us. And then if we do, we'll be in a better financial position. And if it doesn't, then we're able to weather that as it happens. And the other thing is the enrollment calculation. So last year we started this process. We said state's going to run some data. We're going to look at what it means to transition to minutes per week, and we're going to talk about that impact. And so now we're doing it. And so now we're using that data, and I think there's just some questions of, okay, now what are the logistics of how that calculation works? What does it mean to have fractional enrollment? What does it mean for what our calculations are? And I think we're still answering all those questions. So we're in the process of doing our first IC upload. That'll get our first snippet of where we'll be able to see, okay, how does the enrollment calculation work, and what does that look like when we run it through support units? And what does that mean for us? Is our number maybe not as bad as I had calculated, right? You know, and so right now I did a bunch of data analysis with the way we did it last year, and I'm kind of relying on that data as our first touch point to be able to then use that and evaluate how it's going to look for our budget going forward. And so what we'll start to do is we'll evaluate that data. The state has some great resources available for us to look at minutes per week. Our data team, I was just in meetings today, and we're evaluating, are we sending them all the right data? Are we capturing all of the students? Are we able to get all of our minutes so we can qualify for as much funding as we can? And so really on both of those items, more information to come, right? So we've done some initial calculations, we've done some review, and we're going to continue to evaluate that and look at the impacts over the next 4 to 6 weeks. And then there's the next conversation, so CARES Act funding. So in particular, this is going to focus primarily on the governor's distribution. There's a lot of CARES Act funds. There's a lot of other funding streams. Those are mostly dedicated as to purpose. And I know this is the one that has probably the most questions associated with it. So we're going to receive roughly $12.7 million. We're going to receive, it's right at $315 per student based on last year's enrollment. So the CARES Act funds are federal dollars. So we've heard a lot of conversation about is restoration or is it a distribution? And so this ideally was helped and built to cover our $99 million, the 5% loss that we had that we took at the beginning in July. It's not dollar for dollar. And in particularly, it's not the same compliance associated with it. So these are federal monies, and they have different federal compliance. Those are things that Kristen and I will work on as part of we walk through the process and federal distributions and how we can spend these dollars. Versus with the state funding, they usually either have statutory provisions or it just comes to us in a discretionary allotment associated with salaries, and we're able to spend it as such. So with the federal money, a couple of key things, right? There's some budget and COVID requirements that should be associated with the needs of COVID or because of COVID. There is a requirement in some situations where it has to be additions to the budget. That's not always the case. Treasury is providing guidance. So for these monies, which is a little different for an educational organization, we're used to worrying about title regulations, and we're used to looking at education guidelines, and now we have a different entity that's helping provide guidance. There is a requirement to spend it between March 1st and December 30th. So there are some things we know, and then there's a lot of things we don't yet. So guidance is still coming out. We got Q&A in September 2nd. That's been some pretty good guidance, and we're continuing to get more every day. And then there are some really great groups who specialize in providing this kind of guidance, and I've been able to visit with them and go to a webinar and be able to kind of learn how it is we can utilize the dollars. So what you're going to see on this list is some of the things we're looking at. So this should give you kind of a flavor or a taste for how we're going to use the money. So so PP&E, obviously, it was COVID related. It's dollars we're using, so we're buying masks. Some of the things that we already bought will still qualify, so we'll be able to purchase both more hand sanitizer, all the things that you would think about. Some curriculum development work we did over the summer will qualify. Curricular materials that we bought. We're looking to distribute and install water bottle fillers since water fountains have been turned off. The FFCRA leaves, so the Coronavirus Relief Act, so that's associated with the leave that people can qualify for because of this leave, is an allowable expense, as you would anticipate, right? It's a federal government program, and so it qualifies for reimbursement. Hotspots, so a calculation and a lot of dollars that we've been spending to make sure that we can get internet. For our students, we're able to not only use it for dollars we have this year, but the expenses we had starting in March, we're able to go back and say, okay, you can reimburse us for that. And so there's a process that we work through to be able to qualify. Health services staff is something else that we're looking at, and whether we'll be able to get reimbursement for those costs, SROs, and then if we have to look at purchasing loaner devices associated just with our one-to-one device. So what you'll see is you'll see some items on the list, and then what you're going to see is the really important process of this, is that we're working with our auditors. And so the stance that I guess I've taken and that many districts have taken is that our auditors are the one who's going to come back and help us with this testing process next June. We're going to be responsible for compliance associated with them. And so what we're going to do is we're going to work together to identify what guidance allows us to do, what things we can do with these dollars, and what things we can't do with those dollars. And so Kristen and I don't know how many emails we have shared back and forth over the last 2 weeks, discussing ideas, looking at guidance. leveraging the resources she has, leveraging the resources that I have, and being able to try to figure out how we maximize this funding and the allowable provisions of it. And so much like what I said with the budget, I feel like I'm going to say it again, more information to come, right? So we have a plan that we're working on. I'm hoping to get that finalized in the next couple of weeks, and then I'll be able to tell you this is exactly how we look to use it. And here, important for you, are the compliance requirements associated with it and how we can use it effectively and allowable. So next steps, we're going to look at finalizing those expenses. We have had some discussion with the association of how we can use those dollars. Again, it's all education and making sure that we can use them effectively. And then we'll continue to work on our CARES Act funds. And then if at your discretion, if you would like a revised budget, we can go through that process at the board level and publish and then be able to give it back to you. And we can do that now or later as part of our typical budget adjustment process that we do later on in the year. And with that, I can stand for any questions you have.
Excellent. Thank you very much, Mr. Gillen. Trustee Smiley?
Thank you, Mr. Chairman and Mr. Gillen. You said there'd be some questions, and you were right. The one I have, going back to the governor's, under the CARES Act and the, the holdback that we had last spring of the 99 million. And then basically, the state now has, I believe, a $557 million surplus. And out of that, the governor is saying he will restore what was taken away, but it's coming back in different categories. Am I correct? And so I'm still a little fuzzy on how that math works. And the money that's coming in with the CARES Act plus the restoration of the original budget, does that present any challenges as far as just paying salaries, doing the things we always do? And how does that work? If you could go over that in a little bit more detail, I'd appreciate it.
Trustee Smiley, trustees, Dr. Reynolds. So I think when you look at the dollars, so the dollars that are coming back, so we lost 5%, roughly 99 million, and we kind of walked through what those dollars were in June and July. We talked about leadership premiums, and we talked about salaries, and we talked about an IT allocation, and those were very specific as to purpose and how we use those dollars. And so in this case, this distribution, I'm not going to call it a restoration, but this distribution of dollars, which we're very grateful for and able to use, it doesn't come with the same stipulations. So it's federal compliance money, and so Department of Treasury will be able to provide us guidance on what's allowable. So while it is the same dollars, we may not be able to use them in exactly the same way. And so that's part of the process that we're working with our auditors. The dollars are going to flow in through the general fund. So not to get too exciting about financial statements, but you're going to see it come back in to the general fund just like you normally would have. But again, it'll be specific as to purpose. And so what we'll outline is what we can do with those dollars, and we'll make sure that the things that we're going to do with it not only will meet the provisions of the timing of finishing before December 30th and meeting, it's obviously associated with COVID, but the other allowability requirements associated with it. And so it may feel like the same, it may even look like some of the same things, but it'll be because the Treasury guidance allows us to do that.
Mr. Chairman, if I could follow up, because you touched on some of the things I'm really interested in, and that is our educator premiums and the gifted and talented, a lot of the IT stuff we've been doing. There was a whole list of things that they weren't required by statute, but they were things that really made our district special. Some of those things that we do, getting some of that extra money to our teachers that are willing to take leadership, that are willing to do other things that would qualify. Are those going to be preserved, or are they still up in the air a little bit? Because those things that we do that are those extra things, I think especially now in this crisis, we have so many of our educators and so many of our staff that has gone way above and beyond, and being able to find that money to somehow make sure they're whole is really important.
Trustee Smiley, members of the board, possibly. And so I think what comes in is really it's what we can do within allowable guidance, and we're still figuring that out. And so some of those questions are going to take a little longer. When you talk about PP&E, really easy, right? And so we can answer that question and know that it qualifies. When you talk about can we use it for salaries, that gets into different federal compliance rules, and so those are the questions that we're working on trying to interpret. Does the guidance let us? How can we do it? Is there a certain way we need to do it, and what does it look like? And those are just answers we just don't have yet. And it's not just us, it's a lot of districts and a lot of organizations who've received that funding who are trying to evaluate those same things to make sure that we maintain compliance. What we don't want to have is a situation where you have what they call a questioned cost. So during a federal audit, they come in and they say, you really shouldn't be doing that with the federal dollars, and so essentially you have to pay those back. And so that's why I think it's important for us to continue to work with our auditors and identify how that process is going to work and make sure that we're both comfortable with how it looks and what it is we use the dollars for.
Yeah, because that is something, Mr. Chairman, thank you. That's one thing I'd really be interested in the follow-up, and those things that affect staff, those things that affect those programs that kids are involved in, you know, and also the IT. So those would be the things I'd like to follow up on. Thank you.
Thank you.
Thank you, Mr. Chairman.
Trustee Johnson?
Thank you, Mr. Chairman. Jonathan, I have a couple like minor questions I can ask later. They're not big deals. So I want to actually just kind of provide some thoughts. First of all, in answer to your question on board relook and approval and board input, I would say resoundingly yes, from my opinion, that we should have some review of that. And specifically my reasons why for that is because right now we're kind of operating in crisis mode, right? We're trying to manage through a pandemic and we have some major financial issues that we may need to think about as far as addressing to make sure that we get the remote learning levels up to the educational level. If we have any, we still haven't actually ran our remote education with 40,000 or 38,000 people on it. And so we may have some purchases there. So I would say yes, board input, absolutely, and guidance. From a financial standpoint, you're doing exactly the job you're supposed to do, right? From my view, which is protect our risk for overspending money we don't have. There's a flip side to that, and this is where my view from a trustee role, and that's what's the opportunity cost if we estimate super conservative on, for instance, I think the one that I was thinking of was that we don't get any support unit protection, right? That's in statute. If the state doesn't step up and do that, I mean, there's a risk, but how much risk should we take with the opportunity cost of a kid's education? And that's the kind of balance that I'm hoping we can strike a little bit more, to not be so conservative that we make sure the education comes first. And then the third one is kind of the funding sources and the funding information. And what I have looked at in the budget is we've got initially the governor increased school budgets, and the governor and legislature approved a little over a 5% increase for public schools overall. They did that during the legislative session. Then they took it away. So they didn't actually decrease us 5%. They decreased us, they took away the increase year over year. That was the starting point for COVID. They've came back and said, we're going to give you specific funding around PPE, I think, testing, and then they've given some funding for parents outside of schools' budgets. I think those are the categories that I know of. You could add probably more than I can. Then they said, we're going to give you back the 5% increase through the CARES Act funding, which is a different spending category, right? Plus we got the levy approved. When I kind of run through all those numbers, we're at least at around $29 million if we count the fund balance increase. That's a fair amount of money, and I think we have to be really, really focused on making sure we use that money to make sure that we do what we need to do for staff, but also we make sure our system works really well for our kids this year, and we spend it in a way and do it sooner rather than later. So I know we're still waiting on a lot of information, but if we get it next board meeting, we're going to have 60 days to spend $12 million. So I would encourage us to put a sense of urgency around this if we can, and make some assumptions that we're just going to have to make, and we'll know there's some risk that we may have to pay some federal dollars back. That's it. Thank you.
Thank you. And the trustees, Trustee Ozuna?
Thank you, Mr. Gillen. Couple questions for me. One, I was just wondering if you could walk us through the timeline on what you're thinking for working through this, and then when it'll come back to the board. And then, along with the timeline there, I didn't realize that this was money that had to be spent March through December. And so I imagine part of what's going into this are dollars that we've already spent. Do you have any sense of how many of the dollars that we've already spent you're looking at being geared toward these dollars? PPE, for example.
So,
Or is
Chairman-
that too early to say? Because that's a fair answer, too.
Chairman and trustees, some of it we already know. So Trustee Azuno, we know that we've spent at least $100,000 in PP&E, for example, and we know of another couple $100,000 already, plus some expenses I still have yet to identify from facilities. So those are dollars we already know. There are dollars, I'm just trying to think as I go through the list, as we look at expenses, if our health services staff can qualify that we've incurred last year, that we'll be able to use to reimburse ourselves for costs incurred. So while there are, just to provide some context, so from the moment that we found out this money was coming, we started working on what it looks like to spend it and how we do it appropriately. So I can tell you that we've been 3 weeks in, 3.5, I think, from the moment we kind of knew this was coming, and that's when the clock started for us. And so we have been working on what it is we feel like we could use and what will qualify. And so as we talk about process, I'm hopeful that as we look at budget, right, we're going to do our first IC submission in the next couple of days, and then we'll be able to start pulling data out. And so that's our first checkpoint of how support units are going to look. We won't know protection, but maybe we'll be able to pull out some data to see what it looks like from the rest of the districts. So until we have that information, it's really difficult for us to manage that risk that was referred to. And so over the next couple of weeks, I think we'll be able to start really identifying what it is we can do with these CARES Act funds and what we can do and what our budget kind of looks like, right? So then, you know, as we talk about board meeting on the 27th, and then the process with the association will have to happen sometime after that, should we choose to go that route and what that looks like. So more information to come probably in the board meeting 2 weeks from now, if that would be at your guys' request.
Any other questions? Mr. Gillen, thank you very much. I appreciate it.
Thank you.
And that ends our spotlight section for this evening. It moves on to the regular session. Clerk Newbold, do you have any changes or updates to the agenda?
Chairman, trustees, Superintendent Reynolds, I have attached all the additional information. However, there's probably 25 to 30 patron comments I have not attached yet, and we'll do so later. Thank you.
Excellent. Thank you very much. Trustees, do you have any updates or amendments to the agenda? Seeing none, then we'll move on to the consent agenda. Do I have a motion for the consent agenda? Trustee Smiley?
Mr. Chairman, I would move that we accept the consent agenda.
Thank you very much for that motion. Is there a second?
Second.
Trustee Newhoff with the second. Is there any discussion? Seeing none, all those in favor, please say aye.
Aye.
The chairman is aye as well, so it's unanimous. That then brings us to the discussion portion. We have 4 items under reopening plan update, and item number 1 is data transparency, and Ms. Char will present that section. Ms. Char, you have the floor.
Chairman, trustees, thank you. Dr. Reynolds. I would just ask that Troy go ahead and populate the screen with our proposed dashboard. So this is something that we've been working on for several weeks. It has not been an easy undertaking or a decision that we've entered into lightly. We have struggled with the concern over protecting student and staff privacy when releasing numbers, and it's been a process that's been extremely time-consuming and a team effort. Data analytics has been kind enough to help us with this sandbox, so this is not live yet. Right now, I will turn it over to Tracy Gardner, our health services supervisor, and she'll walk you through a little bit about how we obtain this data.
Good evening. So in response to requests for to be able to identify numbers in cases in West Ada School District, we looked at a couple things. First, We were concerned about being able to identify individual students and staff and protecting their personal health information. Second, we were operating under the understanding with conversations with Centric District Health that Idaho Health and Welfare would be putting forth numbers by school. So versus replicating that same effort, we were relying on Idaho's Health and Welfare to produce that data. That data came out and appeared to be incomplete. If you looked at the cumulative data, it seemed to be accurate, but the week prior data was definitely not accurate. So we looked at how can we provide information to meet the needs of numbers, to meet patrons and board members' requests for information, but also protecting patient confidentiality. More important too versus numbers is the story behind the numbers and how we would like to create a dashboard that communicates to our patrons, our parents, our students, our staff about what's actually going on in West Ada. And positive numbers don't do that. So for example, at one elementary school, you'll see they have 4 cases. You won't see it on this dashboard, but let's say if it was by school, you'd see they have 4 cases and everybody goes, oh my gosh, they got 4 cases, what's going on? Little do they know it's one family and they've never attended in-person school. So there's no exposure, there's no contact. So numbers alone don't demonstrate what's actually going on in the district. So I'm quite proud the district is looking to put together a pretty robust dashboard. This is the beginning of it. I can explain this, but you'll see future rollouts with additional information that's of value to include student absenteeism rate, staff absenteeism rate, what our sub situation looks like, etc. So we have about numerous metrics that we will eventually be rolling out and looking at. Today we're just looking at a summary of our positive cases. It demonstrates how many staff we have versus how many students. It gives you the last 14 days cumulative total based on staff and student, your total case number in that 14 days, the cumulative average, and then it gives you a district case per 100,000. The value of that is that we can look at Ada County, and Ada County, as you know, provides information on cases per 100,000, and that's how they determine their green, yellow, and red. Today we moved into red. The cases per 100,000 in Ada County was 22.14. If you look at West Ada's numbers for last week, it was 9.42. That just gives you one piece of data, one piece of metric as to what's going on in West Ada, and it helps with making operational decisions. We broke it down by high school, middle, and elementary, and again, you get those numbers. We had data back to the start of school, so it's on a week basis, and you can look at staff and student breakdown. Like I said, more information will come. This is the beginning of the West Data dashboard data metrics, and they'll be pretty comprehensive. And I think you'll be impressed with them and be able to see how operational decisions are made. We've always said positive numbers is not how we make those decisions. And we're also working with CDH. CDH has seen this. They appreciate and understand where we're going with looking at numerous metrics, and they've also gave their buy-in and have been pretty impressed. The other thing that takes time to roll these things out is one, as Char identified, it's a lot of manpower hours to create these tools and documents, but as well you have to collect data. So we're 5 weeks in. We're collecting the data, and as we collect it, you'll see more and more information that will help with operational decision making. Any questions?
Trustee Smiley.
Thank you, Mr. Chairman and Ms. Garner. One thing, first of all, just a definition. Could we get a little, kind of a concise definition of what we mean by a case?
A case is a confirmed positive case through CDH.
Does that mean one that's symptomatic or just
It
a
does
positive
not.
test?
It just means a
Okay.
positive test result.
Okay. Then,
It could mean, let me clarify, it could be a probable case as defined by CDH, and a probable case could be either a negative test result with symptoms and an exposure, or it could be that CDH has determined it's a probable case based on the circumstances.
Thank you. And then the second is, will this dashboard be available on the website?
That is our intent.
Thank you.
Any other questions? Trustee Newhoff?
Thank you, Mr. Chairman. I have to scoot over. Mrs. Garner, I had two questions. The first is, are there any plans to include the number of quarantines that we have in addition to isolation, so we can get a sense of how that impact is affecting our district?
That's a great question. That's actually where we feel a lot of focus should be. You have one positive case. How many students, staff are impacted through quarantine? And so, yes, we are looking at collecting that data. That is pretty time intensive when you're looking at contact tracing. But we are looking at collecting that and being able to present that in the future.
All right, thank you. I mean, we've been sort of collecting data on student absences for a long time, so it seems to me that there's some experience there to leverage in that. The other thing I want to kind of explore with you a little bit is how we're identifying cases, and particularly if you're going to go to the point of calculating a rate per 100,000 in the district or at various levels and comparing that. So you mentioned the state's database, all right? Absent you providing the state with the information, or the state going and doing what they're actually doing is combing through Facebook and media reports to get case identifications for schools. All right, that's where that data is coming from on that state database. I guess the question is, well, I've got a couple of questions. One is, are we doing everything we possibly can to identify all the cases? And which really gets into back to whether we're able to identify them and do the contact tracing that's going to keep this problem to a minimum, or as minimal as possible. But also, like, one thing I would imagine you're not doing is, say, a kid's in VSH and they have COVID. You're probably not counting them, I'm guessing. Is that correct?
If we have that data, absolutely, we would.
Okay, so I guess that, you get into this problem of what your numerator and denominator are here. And so if you're going to not have access to, for instance, 10% of the kids' information, and then include them in the denominator, you've got a math problem there.
Correct.
So I guess, can you kind of explain where we're getting the information at the district level that, for instance, came to the board about various cases and is going to end up populating this?
Okay, so you started with Idaho Health and Welfare and where they get their data. That's a question to ask Idaho Health and Welfare.
I have.
They do get lab reports. They're the central holding place for lab reports. That's where CDH gets their information. That's the communicable disease process. How they affix those lab reports with positive test results to individuals in school is a process. And that would be the process you would ask Idaho Health and Welfare. In recognizing the challenge that they have, so for example, at one of our schools, they identified a positive case, well, two positive cases, because those students lived in that geographic area and they attributed it to a high school, when in fact those two individuals were attending online schools, not virtual schoolhouse, but other online schools. And so once that was clarified, those numbers will be fixed. With regards to West Ada, we get our positive cases from numerous sources. We get them from parents, we get them from staff, we get them from the students themselves who report it, and or Centric District Health gets that information. So if we get the information first, our process is then that we collect the data and contact Central District Health, as well as Central District Health contacts us and lets us know of students in the community that have positive cases, and then we can identify what school they're at. So it's a multi-tiered process. We're coming at it from multiple perspectives. I'll tell you, I spend 2 to 3 hours a day on the phone with Central District Health, tracking down students and staff and where they're at,
Okay, thank you.
in addition to a multitude of other things. But there is a process for that.
Trustee Ozuna?
Thank you. I have several questions. Thanks. This is, for me, this is a start. I just want to make it very clear that as a board member and as a parent in this district, and we're talking about our staff and student safety, I expect to see transparency, and I only think that this is a start. I guess I want to understand why we're not intending to report this by school.
So, couple things, personal health information and protecting students and staff identity is important. When you have schools of less than 500, it makes it really easy to identify who the missing staff or student is. And unfortunately in our community, as in this nation, when somebody gets diagnosed with COVID, there is a social stigma. We've unfortunately seen it. And so our goal is to protect that personal health information and the identity of those that are positive. We are looking at how we can be, so the thing about transparency is that it has an accountability portion of it and accountable to all parties. And so it's not just giving numbers or information for the sake of giving it, it's giving it with intent and purpose and protection of the information. And so we're looking at doing that appropriately and trying to give as much information as we can. If we're looking, and Central District Health will back on this, if we're looking at sharing information of positive cases so that people can make decisions, the exposure and the contact has already occurred. So we're trying to look at a lot of things rather than just positive numbers. And like I said, there's not always the story with just a positive number, but most importantly is confidentiality.
So I understand that, and I greatly appreciate that. We have a lot of schools over 500 students, so that's a place to start. For those that are under 500 students, Department of Health and Welfare are reporting those numbers. And we have school districts throughout our state and throughout our country that are reporting those numbers. So I would like to get some legal guidance because I think that they would support us in providing these numbers. I understand what you're saying, that the numbers are only a part of the story, but they're an important part of the story to our staff and our parents.
So we have received legal guidance, and we also have support of the Idaho.
Yeah, recently, the Idaho School Board Association's Policy and Government Affairs Director agreed with the idea that when you have a small school, or perhaps not even a small school, when you start identifying groups, especially like an athletic team, it becomes so much easier, like a band event or activity, to figure out who that is. So we've had, while we do realize the importance for parents to know what's happening in their school, we also have to just keep in mind of the privacy, and we're not alone in that. This is going on across the nation. There are also several districts who don't want to report by school. We're not the Lone Ranger out there by any means, and we're not moving in a direction that we're not going to provide this.
I think that we can provide accurate numbers ourselves, or we can let our community report the rumors and the inaccurate numbers that we know are being provided today. So we can get some trust from our community in reporting these numbers, or we can take an opposite approach that's, to me, doesn't seem to be working. A couple other questions. You talked about that this is just the first start of the dashboard and there's some other things that we're adding to it. When is that going to happen, and what resources do we need to make that happen very quickly?
Chairman, trustees, Dr. Reynolds, this piece of the dashboard will be published this week. So once we get that in line and we realize that we have a good workflow for providing this data, then we will begin as early as next week, moving on to the other portions that are going to show things that Tracy just spoke about, like quarantines, school by school numbers. So I don't have a time frame from our data analytics team, but just knowing how quickly they work, I would guess within the next 3 to 4 weeks, but I would be hesitant to speak for them.
Follow up to that, Dr. Reynolds, if we can see what it would take to make that happen sooner, that would be greatly appreciated. And the last question that I have is, what is the communication that goes out to parents and staff for exposures?
So,
or what does the process look like to identify an exposure and then to reassure our parents and our staff that they are getting notification when that's been identified?
So just as an overview, Chairman, trustees, I'll speak to that, but then Tracy might want to interject. So once we find out there's a positive, that's generally, say for example, it was the teacher. So they would send that student to the nurse, at which point she would evaluate and send the student home if they were ill with COVID-like symptoms. So at that point, that student just goes home, and then we would learn later what happened with that. So did they reach out to their healthcare provider? You know, what kind of advice did they get? Then in the other scenario, if we have a parent reach out to us who say, my student's tested positive, then that's when we begin the process with Central District Health. Have you received this positive test result? They let us know yes or no. In the past, if they say no, but we have confirmation from a parent that they have the result, then we have gone ahead and worked with the principal to get a letter out to the affected individuals, or perhaps it's a whole program, and we send a letter out, and they also, most of the time, principals want to have a conversation with those parents on the phone, just to have that one-to-one contact, so they've been phoning them and sending out a letter. Would you add anything to that?
Does that answer your question, Trustee? Okay, thank you. Trustee Johnson?
Thank you, Mr. Chairman. I have a couple kind of questions. One, first of all, I'm going to echo what Trustee Ozuna said. If the state's providing the data that way, I don't know why we're not being as transparent as the state. I think that's a poor decision, because we're going to get crosswise with their data and our data, and that's never a good thing. I don't have any questions on it. I can understand the stance. Unfortunately or fortunately, you know, we were out this week, the entire week, my kids on vacation. Somebody could have assumed something was wrong because of it, but people are going to be out. They're going to be out for quarantine. They're going to be out for positive tests. They're going to be out for missing days for doctor's appointments, whatever else. So, and I think our schools are all big enough that we're going to have absences just from purely parents keeping kids home because they want to make sure that they're keeping everybody else around them safe, which is a good thing. So I think we have a communications responsibility to make it about that positiveness and not about the negativeness of not sharing the data. So when I look at this data, cases per 100,000, is this all a 2-week rolling average? Is it the year-long figure? What's the definition of what we're using in those averages or those figures? That's what I was trying to figure out.
The cumulative average?
So we have cases per 100,000 at each one of the levels.
That's a 2-week.
2-week, okay. It's really important we label that. So, because people are doing it differently all over the place.
Data analytics is,
yes,
they're doing that.
And I don't know if you're looking for feedback, so I like the model, it looks great. One of the things that has, because I've been looking at a ton of data trying to figure out, because we haven't had data really to make decisions off of, so, you know, we've been pulling from everywhere, and we've only been doing this for 3 or 4 weeks. But the other piece is there's cumulative, and then there's the rolling average, but there's also the new, right? So how many new are coming in each week? And if I were to ask that question, where would I find that on this dashboard? Like, is it just, are we going to keep the new cases for the whole school year down here, or are we just going to show 4 or 5 weeks? What's our kind of structure there?
We talked about doing 6 weeks.
Okay.
Because Summit Centric District Health looks at the 6 weeks, so we could look at the 6 week.
Okay. The reason that I agree with Trustee Zuna on the other piece, which is getting this out faster, sooner rather than later, and I don't know, is this data accurate right now? Okay. Makes a really big difference, right? It makes a big difference in your decision making, whether you can make your decision making off of your school system or you have to make it off of a county system that has a whole bunch of other positive cases that don't impact directly our school system. So the sooner that we have it, the better, and the more we can start to use it, the better, in my opinion. Thank you.
Thank you.
Any other questions or comments? Trustee Smiley?
Thank you, and this is for both Char and Tracy. I would just like some guidance of, obviously we have some holes in data collection. Are there any steps that we can take to, to improve, number one, the data collection, and then number two, I've been hearing a lot of complaints about that the communication isn't very timely and it isn't very accurate. So what can we do to help with both those areas, data and communication, to make both of those better?
We're currently looking from some of our performance improvement and looking at opportunities and ways that we can improve. I'll definitely keep that. I appreciate the offer and report back to you through Sherry and let you know any ideas I have. Thank you.
I would just add that we are looking at possibly contracting out our contact tracing. So that would free up some of Tracy's time to just ensure that she has enough time to give us correct data. So this is updated accurately.
Ms. Gardner, Ms. Jackson, thank you very much. I appreciate your presentation tonight. That is about 7:10, so I thought maybe we should take about a 5-minute break before we move on to the next session that might be a little bit longer. So if you would, just let's break and come back at 7:15. Would that be fair? All right. but. Yay. Excellent. So that brings us, we are back in session. It is 7:17. And our next section under reopening plan updates is the survey results. And again, Ms. Jackson will be presenting. Ms. Jackson, you have the floor.
Chairman, trustees, Dr. Reynolds. So last week we closed our survey that went out. I will just go over quickly that 51% of parents responded, 63% of staff, and a smaller percent of students, 29%. It's maybe interesting to note that 71% of parents opened the email, but 51% chose to go ahead and actually fulfill their obligation to, or their option to respond. So we started with the first question that would indicate at what level their student or students currently attend. So we had the largest response from elementary, 54%. We asked, do you support a change to the plan in K through 5 to allow students to attend in person on alternating days when Central District Health is in red? So you can see that 71% said yes. We asked a similar question, a change to the plan for grades 6 to 8 to allow students to attend school in person daily when we are in yellow. A similar percentage, 72, said yes. Do you support a change to the plan for grades 6 through 8 to allow students to attend in person on alternating days when the district is in red? 67% said yes. Do you support a change to the plan for grades 9 through 12 to allow students to attend school in person daily when we are in yellow? 67%. And grades 9 through 12 to attend in person on alternating days when we are in red, 64%. So this moves on to our staff survey results. We asked what describes your role, so you can see the largest percentage that responded were our certified staff by 59%, nearly 60. So we asked similar questions. Do you support a change to the plan in K through 5 to allow students to attend on alternating days when we were in red? And you can see that the yes was 45%. Middle school, again, certified, largely responded, 65%. So we asked them, do they support a change to the plan for grades 6 to 8 to allow all students to attend daily when in yellow? The yes was 31%. Do you support a change to the plan for grades 6 through 8 to allow students to attend on alternating days when in red? 38% said yes. Moving to the high school staff survey results, again, certified largely responded, 63%. When asked if they support a change to the plan for grades 9 through 12 to allow all students to attend daily in yellow, 34% said yes. Asking if 9 through 12 should be allowed to attend on alternating days when in red, 37% said yes. So moving to the middle and high school student survey results, you can see we asked what grade they were in, so largely the high school grades responded to this survey. And we asked if they support a change in the plan for grades 6 through 8 to attend daily when in yellow, and 73% said yes. When asked if they support a change to the plan to allow 6th through 8th grade to attend on alternating days in red, it was 55%. Asked grades 9 through 12 to allow to attend school in person daily in yellow, 59% said yes. Grades 9 through 12 to allow students to attend in person on alternating days when in red, 55% said yes to changing that plan. So, as you all know, survey results are just one data point that we use to guide our discussions and our decisions and the plans that we move forward with. We have had several discussions with Central District Health. Recently, they hosted a panel with our staff. We also look at community data, positive case information, which of course you just heard about recently when Tracy was up here, and meetings with outside health professionals around our plan and discussions with other districts around the country who are doing in-person right now and what the lessons they've learned from that. And we also are dealing with substitutes needed to cover classes for staff who are in quarantine or isolation. I'll stand for questions.
Thank you very much for that presentation. Trustee Ozuna, please, if you have questions.
I just have a couple questions on this. We get a lot of email from staff and parents right now, and there seems to be some of our schools that are reaching out more concerning some concerns they have around our safety protocols. Did you look at the survey information by school? And if you did, are there any significant differences?
We don't have school-specific survey information.
I think in the survey for teachers, they were asked what school they belong to, I believe. Can we get that information by school?
Teachers were asked what level.
Just level. Teachers were asked level.
Parents were asked what school. I don't have the breakdown for the individuals. But parents, I'm sorry.
Go ahead.
I apologize.
I thought that
Trustees.
the teacher survey asked what school. Anyway, it's
can look it
okay,
up.
but if we have the ability to do that, I'd like to see it, just
Okay.
because there are some consistencies.
Sure.
Yeah.
The parents specifically were asked what schools their kids went to. However, because they were allowed to choose multiple levels, elementary, middle, and high, in case they had students at all of them, you won't be able to say specifically just elementary parents said this. I mean, I could break it down for you by school as to what each individual responded, but it wasn't just a one survey, one answer per school, per student type of survey,
Okay.
if that makes sense.
It does.
It kind of muddies the water.
The reason that I'm asking the question, and I'm not surprised by the survey results, I think it's kind of what I would have expected to see. But what I'm wondering is if we have situations, school by school, where we have different cultures in the schools. And I would just wonder if the results of the survey would be different depending on how the safety protocols are working school by school, and if we can get to that information, and that would be specific to the staff ones. And if we can, then drilling into some of the whys there, I think would be really helpful. And so then my second question was really around the whys. I did not have a chance to go through all of the comments, but if anybody has made it all the way through, have we kind of bucketed those, and do we know in general what we're hearing? I mean, I know what I'm hearing in my emails. I've been all the way through my email, but just wondering if there's, what you're finding, what kind of patterns you found through that.
Chairman, trustees, Dr. Reynolds, we have not gone through the comments to put them in buckets, but that's certainly something that we could try to find the bandwidth to do. But just going through them the way I did, it's really mixed, right? So but it's certainly something that we can, carve into buckets.
Trustee Johnson.
Yep, thank you. I had a question around the 30% of parents who didn't open the email at all. Do we know if that's because we actually have valid email addresses for them, or if that's good data or not, the contact information?
Chairman, trustees, Troy can speak in detail about that, but I will tell you that we did have some feedback, and he personally reached out to 200 people who had trouble with the survey to make sure they got it, and we're confident that our email list is good. Now, we can't always control if the email provider puts it in a spam or a junk. Not always control. We can never control whether an email provider puts it in a spam or junk folder, but we did send out several communications indicating that people should look for it there.
The numbers we're reporting, Mr. Chairman, trustees, Dr. Reynolds, the numbers we're reporting are the actual emails that we believed were correct. So we'd already filtered out ones that we knew that were wrong. We filtered out the ones that bounced back to us. So those numbers we're looking at are good numbers, or good email addresses, excuse me. we sent out our first survey, and we're getting responses back that it was going to spam. So I immediately contacted our provider and asked what could we do. They gave us a couple of hints of things we could put into our server to help with that. We did that. And then after a number of days, I sent out 3 other reminders. So I followed up with a number of people who said originally they didn't get it because it went to spam, got those reminders days later in their inbox. So I feel pretty confident with the surveys being reached into the inbox by the time we started doing those reminders. And like I said, I've responded to almost 200 people individually who didn't get it for various reasons. A lot of them were because they didn't have the proper information in PowerSchool. This was only delivered to people that were parents or guardians. Sorry, I'm having a problem breathing with this. So we had to have discussions with a number of individuals as to why they didn't get the survey. Because either they didn't fill out the PowerSchool information correctly, or they were listed as someone other than a parent or a guardian. Did that answer your question?
Yeah, it absolutely did. Can I be the student in class that says, Trustee Ozuna stole my question? But I think you know this, so I'm just going to put it on the record. We do really need to do the analysis on the why, and I'll tell you exactly the reasons why. Because of things like if we're sitting at a 54% unsafe feeling, and we have 60% of our staff who answered that question, and majority of those are in school buildings that are not operating at the safety protocols that staff feel need to be, that can sway our numbers pretty significantly. So so I'm going off anecdotal data right now, but in every person that's responded to me with concerns about being on one side of that fence or the other, I've sent back some information to some thoughtful looks at data and information, and almost all of the responses have been, thank you, I didn't realize you were considering all of these things, and also almost all of the responses have been safety protocol issues. That concerns me. And it is anecdotal at this point, so I would really like to have some data on how well our safety protocols are being implemented in our school buildings. And without having that from these survey results, it's hard to know how we impact them. So, and then the one other thing that you brought up in the list at the event, and I know we didn't survey on this, but is substitute data. I've been hearing rumors, but we would really like to see, I would anyways, some data on the substitute. And it's year over year, because my understanding is West Ada has always had some challenges with substitute teachers.
Yeah.
So whether or not we're seeing more because of quarantine, less, people don't feel safe, the why behind all of this is really important. But the data first and then the why is really important. So thank you.
Thank you.
Trustee Smiley?
Thank you, Mr. Chairman. Maybe I missed it, but do we have the number of the total respondents? How many people actually submitted a survey?
Yes. Yeah, for each category.
Sorry. Parent survey, 18,570. Student survey, 6,562. Building staff, which would be mostly our school building staff, 2,779. And then our DSC or maintenance staff, 145.
Okay, thanks. Now, the students, most of the respondents to that survey were high school students, correct?
Correct.
And but even then, it was a a much lower actual percentage that responded. You know, in other words, what I heard was 29%, which would be quite a bit lower. Okay, thank you. Because I think, you know, I'm trying to think back to when I took statistics in college, which was a few years ago, and you know that was one of the things about coming up with, when you do polls, for example, and surveys, you have to have a plus or minus. And would those lower respondent numbers increase the plus or minus reliability quotient on those? You know, in other words, if we had fewer people respond, it makes the data a little bit less reliable.
Well, I mean, Chairman, trustees, I guess that's an argument you could possibly make, but I don't know that I can respond to that adequately, but it seems the common sense would say yes.
Yeah, because it's, you know, I think it's important because one of the things I'm hearing a lot in the data is that parents, and especially kids, they want to be in class. Our staff is more uneasy.
Correct.
And, you know, I can just tell you anecdotally, I'm getting a lot of emails from teachers that have, you know, pre-existing conditions and other, you know, they're caring for an aged parent or, you know, something like that. And so there's, you know, of course, those are the ones that they will send you the email, and many of them are quite lengthy. And so that's always a concern because you know, you can see that just in the raw numbers that you know, our staff is a lot more uneasy. And the kids, I think, are a lot more gung-ho. They want to be in school, which is wonderful. You know, back, you know, it used to be kids didn't want to go to school. Now they want to. So I appreciate that. Thank you.
Thank you.
Trustee Newhoff?
Thank you. And with all due respect to my colleague, Trustee Smiley, actually the kids were less enthusiastic about things than their parents were. Is that?
That's correct.
And I mean, which I found rather fascinating, actually, particularly at the high school level. I think that was the case. Could you summarize for us? I mean, there was, because I don't think it was in the presentation here, the district service center staff results.
Yes. It's okay.
Mr. Chairman, while that's being pulled up, can I ask a question around that?
That'd be okay, Trustee Newhoff? Please, yeah.
When you show the district service center, I think I heard you mention custodial. Can you confirm, is that DSC staff along with custodial? Because I would have thought that belonged to the school.
Yeah.
Okay, so it's staff here at this building plus maintenance at our schools, and then IT as well, right, that are at our schools would be DSC?
Mr.
Okay,
Chairman,
thank you.
trustees, I'm sorry. So when we have employees broken up, if they work specifically at a school, they're designated in our Business Plus system as working at that school. So they would have been in the school building survey selection. We have other people that work at all the different schools. So academic coaches or special services people that go to many different schools, they're going to be designated as working at the district service center. Likewise, with a lot of our facilities or maintenance people, they're designated as being either at maintenance or at the district service center as a whole, because they go everywhere. So let me see. Trying to find the file that I gave to Sherry to send to you. Just a second.
possibly if this is going to be difficult to find, we could just bring this up at over email or something later. It's basically just numbers we're looking for. I don't think it's going to break a bank here.
Apologize. Okay. So the DSC maintenance staff, for the question for 6 to 8 being in yellow, going alternate day, that was 54% said yes. The K5 question in category red, that was 52% yes. The 6 to 8 in the category red was 49%. The 9 through 12th grade, category yellow, was 51%, and the 9th to 12th grade in category red was 48%. So very similar to.
Yeah, and it's interesting that they're all kind of 50-50. I mean, almost every one. And so, remind me, what makes up the biggest part of that population? I mean, what?
Of the DSC and maintenance staff, so that would be the non-specific level. So people that work at multiple levels at multiple buildings.
Yeah, no, but I'm saying, I mean, is that broken out like in terms of maintenance and things, or is it just, they were all just lumped?
No, they were lumped, but I can get you some specific data on that just a moment.
Well, I mean, I don't necessarily need it now, but in terms of kind of piggybacking off some of the comments some other trustees made, it'd be interesting to start looking at some of these different categories and see if there's some substantive differences in their response that might be related to differences in their experience. That might be useful in there. So, I mean, it's...
I'd be happy to give you all this breakdown as much as I can for every single one of the different areas. I can get that out to you tomorrow if that's okay.
Yeah.
We'd asked about schools, and I'll see if I can break it down by school and see if I can give you an additional breakdown there. This specifically certified was 24% of the district and maintenance group. That'd be your academic coaches and special ed folks. Classified clerical was 14%. Classified support staff, which would be me, IT, 15%. And then all the rest were smaller than that.
Okay. Thank you, Mr. Stevens.
You're welcome.
Excellent. Thank you very much. That brings us then, Ms. Jackson, thank you. I truly appreciate this. That brings us then to the next item, item number 3. Mr. Heller will be presenting on adjustment of red per CDH guidelines. Mr. Heller, you have the floor.
All right, thank you. Trustees, Mr. Chairman, Superintendent Randalls. Start off by just saying, I think I can speak for everybody, probably everybody in this room. This is probably the most conflicted I've ever been in my career in terms of how to make decisions, because both what we know about the virus, what we know in terms of our staff and where they are in their comfort and feeling of both comfort and support for any changes, but at the same time what we know and want to do for students in terms of learning. So I'm going to start off by just talking a little bit about a couple things. So Category 3, as I believe everybody knows, today Central District Health did update their category recommendations for all schools in Ada County to move to Category 3 red based on a cases per 100,000 of 22.14. So for some perspective, I believe last week that number was 17.12, and so we've gone up, as you can see, that 5 cases per 100,000 in Ada County. So based on the timing of this release, I think our recommendation is that we would transition to the Category 3 red operations no later than Monday, October 19th. Additionally, on October 9th, during our CDH panel with West Ada staff, they threw out and kind of hinted to some new guidance for Category 3 operations. And then we saw the actual guidance come out on October 9th that gave districts some flexibility to consider utilizing some levels of in-person learning in Category 3 red with physical distancing measures in place. During that panel conversation, they made it clear that they are making this change due to what they view as an importance of in-person learning, and that they only apply this guidance to the lower end of Category 3 based on those cases per 100,000. In their guidance they released on the 9th, you can see this is directly from that. Very clear, all programs should be operating with physical distancing measures in place. At least 6 feet between individuals or small pods. These measures should be in place consistently throughout the instruction day for in-person operations. They define pods as independently spaced groups limited to 3 to 5 students. I want to just be really clear, and I feel like to do anything other than be really clear on this would be disingenuous. West Ada cannot guarantee that these physical distancing measures will be consistently implemented in all classrooms and all settings across the district, even in an alternating day schedule. Now, I think that's an important thing to I think we just have to be really open and understand that that's just the reality. It doesn't mean some classes can't, but to say consistently every class across 56 schools will be able to, I can't say that. And the board, I think, needs to have that information in their hands as they consider any potential changes. And even with all of that, it's my job to stand up here and go through some potential changes for the board to consider. CDH goes on and says schools should evaluate at-home learning or hybrid models if physical distancing cannot be maintained. Okay. So I'm going to go through a quick timeline, and some of this won't necessarily make a lot of sense right now, but I think a timeline is important just for the boards, for this entire conversation I'm about to kind of go through with you. Today, presenting kind of step 1 of a possible proposed change to the plan. That step 1 could be viewed 2 different ways. If we are in yellow, which we are not, we recommend we would begin that step 1 once we do return to Category 2 yellow, whenever that day may be. Step number 1, if we are in red, as we have just been moved into today, we would recommend that we would implement this first step on Monday, October 19th. October 13th, again, later in this presentation, I will be presenting what we would call step 2. And part of why I'm presenting this portion is some of the trustees have indicated they would like to see a timeline for some additional future action that the board might consider. That change, that February, or that step 2 of that proposed change, we would not recommend that go into effect until February 1st at the very earliest. And that would also include an open declaration period. And I'm not going to spend too much time on that because I will talk in more detail on that shortly. So I'm going to start with proposed change to the plan. Step number 1, this idea of a dedicated remote day and or early release day. So our COVID task force, along with district administration, has been exploring options to help provide teachers with more time to plan and increase the quality of instruction for the students who are out of school during remote learning in red and or yellow, the students who are out of school for extended periods of time due to COVID concerns or quarantine. The planning and preparation workload for teachers to balance that in-person and remote learning is significant. I've spent time going to lots of schools and talking to lots of different teachers, and those who are doing this really well are doing it with a lot of hours being spent in order to pull it off. Currently in an alternating day schedule, our teachers are being asked to provide both robust face-to-face instruction in the classroom while also providing remote learning opportunities for students working from home. And due to the large number of students who might be out of school on any given day, our teachers are struggling to provide that consistent high-quality instruction in both the face-to-face and distance formats without also burning themselves out in the process. So the COVID task force, after exploring a variety of options, and this was, I mean, really 3 meetings worth of discussions and then reaching back out to building principals and getting feedback, we are asking the board to consider the following changes. And I will apologize now that some of what we're going to ask you to consider today is a change from even what we sent to you last week as far as what we were proposing. And much of that is based on feedback we received from our teachers, feedback we received from elementary, middle, and high school principals, and then the COVID task force meeting today as we discuss this further. So I do apologize that there's some slight changes to what we are necessarily recommending. So the first is the implementation of an asynchronous remote day on Monday So every week on Mondays for grades 6 through 12 in category 2, yellow, and then obviously there's a caveat there where I say in category 3. That would be dependent on some other board action if we did anything in category 3, but I'll outline that more later. Additionally, implementation of an early release Monday for K-5 in category 2. And again, I will try to detail all of these things for you more as we go, and so bear with me. And then implementation of that asynchronous remote day on Mondays for K-5 in category 3. So all 3 of these, and I'm going to go through them more with you now. So first of all, this idea of an asynchronous remote learning day is an idea of pre-planned learning opportunities, including pre-recorded instructional videos, narrated PowerPoints, maybe it's student projects, independent practice, things that the students can do independently of being on live with their teacher. That second half of that day would then be more of a synchronous live instructional time, and then the day would end with 30 minutes of office hours. As we talked to the state about getting full credit for the hours to do something like this, they gave us some kind of must-dos that we would have to have in place, and they are the first 3 of these items. First, students must be engaged in the teaching and learning process during the asynchronous time. Then you kind of look to the next bullet, which is during that asynchronous time, we would need some method of collecting which students did or did not engage in the learning tasks. We have teachers using things like the Insights application within Teams to track that information, or doing a forms questionnaire at the end of a task to garner whether students were participating. So there's ways which teachers could have that in their asynchronous time. We need to have some level, straight from what I was told from the state, some level of teacher availability to answer questions that may arise. So if a student couldn't get on to do their asynchronous and they reached out to their teacher via email, the teacher would have some ability to respond to those as they come up. The last bullet kind of came out of a team that has been working and started working today on looking at what does remote instruction need to look like? How do we continue to increase the instructional quality in remote learning? And so the focus of this time, this additional prep and collaboration time, would be for teachers and teams to continue to identify and implement methods for increasing the level of engagement and effectiveness of remote instruction in yellow and red. Now, I want to be really clear. We have amazing things happening in classrooms. I've seen it firsthand. But we also have things that maybe aren't as amazing happening, and we need to find a way to increase consistency of that effectiveness across our system, because we know we're going to be spending significant portions of our year in remote learning scenarios, whether that's in an alternating day, in a full red system, or with students who are in quarantine and have to be at home for 14 or even 28 days. We need to find a way to make sure that what we are providing is at a high level for all students, regardless of what school they attend or what teacher they are assigned to. And part of that for teachers is they need the time to pull it off, because it is a heavy lift for teachers. So if we were in yellow, what this would look like is that K-5 students would attend in person 5 days per week, as they are now, with early release on Mondays. 6 through 12 students would attend in person on alternating day schedule with remote Mondays, and all students would attend remotely from home on Monday. Team 1 would attend in person on Tuesday and Thursday, and Team 2 would attend in person on Wednesday and Friday. If, and there's the big if out there, the red elephant in the room of if some level of in-person learning were to happen in red, then it would look like this. K-12 students would attend in person on alternating days with a remote Monday. All students remote learning on Monday, with Team 1 in person on Tuesday and Thursday, Team 2 in person on Wednesday and Friday. And again, this particular implementation is based on changes that I'm going to talk about more in a bit that the board would still have to approve before we move that direction. Just to give you an idea, again, these schedules are tentative, but what a high school asynchronous day might look like. You can see on the left, you have your student schedule where from 8 to 11, they are doing asynchronous remote learning. You go over to the right-hand side, that 8 to 11 time is their prep and collaboration time. Important to note within this schedule is Wednesday would no longer be a late start day in this type of a schedule. We would move our collaboration to Monday morning, and there would not be a Wednesday late start, so Tuesday through Friday would be a similar start time for all 4 days. A lunch period, and then students go to the asynchronous piece of their schedule where they would see each of their teachers for 45 minutes for a synchronous live session, followed by office hours at the end of the day. Again, this is just the tentative schedule. Once we get official board approval, then our high school folks will put together their official schedules, but they will look very similar to this. Middle school, if you know anything about middle school schedules, they become really complicated because you have to run a lunch for every grade level and things get a little weird, but you can see the idea that you again have asynchronous remote learning followed by check-ins with each class period. Because of the nature of middle school where kids take 7 classes, you see that those check-ins are now 25 minutes long as opposed to 45 minutes long. Much like in high school, rather than there being 90 minutes of class on that day, they're seeing their teachers for 45 minutes live during that synchronous period. You can see on the teacher schedule for the middle school, and they've already built out what collaboration time might look like versus what prep time might look like. And again, these are tentative schedules for your review. And elementary, if we were using this in red with an in-person alternating day schedule, it would look something like this, with a 9:25 to 12:25 asynchronous, followed by lunch, and then a 1 to 3:55 synchronous learning period, and then office hours. In high school, these are all going to look very similar to you, and this is just as an example. This is what quarter 2 might look like in terms of a remote day on Monday and then a Team 1, Team 2 schedule. Similar for middle, really similar, exactly similar. And then again in elementary if we went this way in red. So just for some review, yellow, the changes to the operational schedule would be that K-5 will continue to bring in their K-5 classrooms to school in person 5 days a week. Mondays become early release day for teacher prep collaboration. 6 through 12 continues to utilize the alternating day schedule with a Monday asynchronous remote day and the Tuesday through Friday alternating day schedule. Timeline for this change. So as of this afternoon, as I outlined earlier, Central District Health has currently placed West Ada in Category 3 red. So the proposal for the remote Monday in yellow would not go into effect until we move back into Category 2 yellow. I would say that's no sooner than October 26th, and that's very optimistic. It is my belief that we'll be in red for 3 to 6 weeks potentially based on the current level of what's going on. So the next few slides that I'm going to talk about do detail more of the operational changes in Category 3 red. I do, with the board's permission, I've asked one of our principals from the COVID task force if he'd be willing to speak on behalf of why this change was proposed, the process maybe we went through, and maybe how the use of this time could benefit us in doing the thing we want to do, which is ensure that what happens in remote learning is going to increase the quality that we all want it to increase. So if the board is okay with that, I would like Mr. Rice to join us and just speak for a minute from the principal's perspective on his perspective both as a member of the COVID task force and a building principal and what this might do for his school.
Thank you, Brett. Chairman, trustees, Dr. Reynolds, thank you for giving me the opportunity to speak tonight. The reason that we really enjoyed this schedule, really number one is, I have to be very honest, professional opinion, our teachers need more prep and planning time, period. In the current system that we're in, it's my opinion professionally, it is not sustainable. We can't continue to ask our teachers to do what they're doing at the rate at which they're doing without continuing to make personal sacrifices. They're making it work because they're sacrificing things at home. They're putting in a lot of time, and so, and again, we got to dial that to a more reasonable level where our teachers feel appreciated and can do the job that we're asking. So with that being said, the remote day on Monday, we started out with Monday, or we kind of bounced back and forth between Monday and Wednesday. Monday, we really felt like teachers could set the week, could put forward some clear learning intentions for their students. In the morning, have time to prep and plan. That would be a pretty structured, it would be a very structured environment. So as you saw in that schedule, we'd start out at the high school level. We talked about all high schools, teachers doing their collaboration from about 7:15 to about 9:15. Again, that's tentative, but that would give all teachers across the board at the high school level, whether you're at Rocky Mountain, Mountain View, an opportunity to collaborate across school lines. And then we would give opportunities for teachers to do the individual prep. They've done an awesome job of delegating work to the best of their ability. And so that would give them an opportunity to then go back to their classroom, begin to do that individual prep time and work. Also be available, as we noted from the state, meet that requirement of being available to students as those emails and things start coming in, as that is a huge portion of their time. We feel like that'll benefit just not only our teachers, of course, but it'll also benefit our students. And we know that because as we look at John Hattie's Visible Learning, the #1 positive impact on students is teacher collective efficacy. And so that is getting groups of teachers together with positive intended outcomes. And so we give them more time, and we will see more positive outcomes from their lessons. A higher level of learning has the ability to occur. Again, with some structure and accountability into that, which is what we're currently working on as well. Questions, maybe I'll throw that out and I can answer more specifically some questions that you may have as a board.
Yeah, so Trustee Uzuna.
I might give you a quick and easy one. I agree. I think that our teachers absolutely do need more time to prep and plan. So I was surprised when I got some feedback from teachers that weren't supportive of the plan. And the biggest concern that I got from the teachers that have concerns with this is that the synchronous time that's being proposed in the afternoon is actually going to take them more time than what they gain with the prep period. How would you respond to that?
So I think it's training. It's given some opportunities for us to work together collectively to give teachers more ideas of what that could look like, how they can plan more effectively, and take away that nerve that's out there right now, you know, that concern that it's going to take more time. That morning time that we would give them, I strongly believe that in the end, the overall impact is going to be positive. For those. And how we lay out those 45 minutes or 25 minutes if you're in the middle school, there's some options. Once you get students going in the right direction and you have kids that know what the clear learning intentions are, you can pull some students aside for some intervention, some reteaching during that synchronous time and work in small groups. And so those are things that we can work through. This is new to all of us. And so just like the teachers, we're learning what's working right now and what's not working. And so that'll continue to be a part of the fluid process that we put in place.
Trustee Smiley?
Thank you, Mr. Chairman and Mr. Rice. From the view at Mountain View, and I trust a lot of your judgment here, what is the biggest problems with the way we're doing this now that you see? I kind of like this whole idea of having Monday as much more of a planning day, but I'm kind of confused about the rest of the week because how would that look like at Mountain View?
Trustee Smiley, are you asking what the rest of the week will look like?
Yes, I mean, I'm kind of getting a handle around what you're doing Mondays, but it's the Tuesday through Friday.
Gotcha. So in a hybrid model, what that would look like is Tuesday and Thursday every week would be Team 1 would report to school. And then Wednesday, Friday, Team 2 would report to school. And then that's where we would get into the synchronous versus asynchronous learning that would occur with the remote. Like Mr. Heller said, we're going to live in a remote setting, so we know that's something that we have to give our teachers opportunities to get better at. More prep and planning will be a part of that process to increase the instructional quality that's been given to kids so far remotely.
Yeah. So what will be the biggest difference we see Tuesday through Friday with, you know, how much time kids are going to be in school? Is that going to be different? How much time teachers have for prep time, things like that, you know, on those 4 days?
Yeah, great question. So it's definitely our professional opinion, the more time that we give to teachers, the lessons that they create and give to students, that quality of instruction drastically goes up. So what we believe that will happen both on the remote and the physical side if we're in the hybrid, well, that the quality of instruction will improve drastically. The culture of our schools, the nature of our teachers enjoying their job in a pandemic, has the opportunity to go up as well, because we're showing that we appreciate the work and the time that we've been taking from our teachers, and now we're trying to give some quality time back to them.
Trustee Johnson.
Thank you, Mr. Chair. Mr. Rice, so weird to call you that. So I love the professional opinion. And right now I'm getting a lot of professional opinions, including one from my second grader on remote learning versus hybrid. So I want to know, do you think this remote learning proposal is the quickest, fastest way to solve the gap we have in remote education, or are there other things that we should be doing in addition?
Well, I don't think there's a quick answer to it. I think in some conversations we've had, our teachers have put in hundreds, if not thousands of hours training for in-person learning. And in a very quick amount of time, a short amount of time, we've asked them to do something very difficult with about maybe 40 to 50 hours total at best training. And so I would be hesitant to say that it's a quick fix, because I don't know that that's accurate. But I just, again, going back to that prep and planning time that we have the ability to give to those teachers, in addition to what they have, that daily prep time that they already have, will be huge for them.
Thank you. And so let me say first, just to make sure, I'm not questioning the remote days at all. In fact, I believe wholeheartedly, and the data shows it in kind of anecdotally, and also kind of if you start to, I'm going with anecdotal, but parents are talking to me about the grades of their students that are high-level, high-performing students that are now not performing in remote settings. So the data is starting to show that it's hurting our students' education, and part of the reason we can anecdotally say is because the prep time isn't there and the teachers haven't had time to actually learn how to teach in this environment, which nobody had to do before and had to pivot. So we do need to have some relief. So I'm wholeheartedly supportive of that. There's a flip side to this, right? So we know one piece of the package is additional prep time. It sounds like there's other things, training, technology, whatever else, the package of how do we get to enough support to deliver an effective remote learning, because we know we're going to need it. And frankly, we might even want it even after this. How do we know in this proposal that it's effective?
Well, I guess I would go back to, again, the John Hattie's research that he's done and put forth. That's thousands of studies that that organization, that group of, the teacher collective efficacy, when we have teachers that can work together, which they do a phenomenal job, that was proven, in the short amount of time that they had to train, that we get more from our teachers, and then therefore our students get more from our teachers. The education has the opportunity to increase drastically. So that's probably the one piece that comes to mind quickly, as far as just data that we know that there's a direct correlation between that prep and planning time and student achievement.
Okay. I think I have one other question, and I guess I didn't catch it the first time around when I reviewed the material, but I've been on 30-minute conference calls as an adult, and it usually takes about 5 to 10 minutes to everybody to get on it. So 25-minute periods in middle school. Tell me about how you think those will run.
I'm probably not the right person to answer a middle school question. That would be probably.
Yeah, I actually knew that. Sorry.
It's going to be a challenge. I think we just need, 25 minutes is a really short amount of time. And so one of the things we have talked about is that time might be, if I go back to a time when I was a middle school teacher and if I were in this position, one of the things I'd be using with that time is to kind of, as Cliff mentioned, set up the learning intentions that we're about to go into the week. So set up my Team 1 kids that are about to come to school in person tomorrow, set up my Team 2 kids that are about to be at home the next day, and kind of start to lead into, here's what you're going to be asked to do. Let's talk about the things that we're going to be working on. Maybe it's a very, very short mini lesson to get everybody kind of primed for what's about to happen that week. There's a variety of ways, and I think one of the things I just know is, as Cliff mentioned, we have fantastic instructional staff. They've been asked to do something dramatically different and turn on a dime to get there. With extra time to plan, we believe that it will help them improve. It's not, this isn't a perfect solution. I mean, I'll be the first one to say, the perfect solution is a full prep day on a Monday that there is no expectation of any learning opportunities, and teachers are just be able to have a whole day to work. That'd be this perfect opportunity maybe. We can't pull that off because we have instructional hours that we have to meet through the state. So this is can we provide good learning opportunities for students, but also provide teachers with some relief? I would say it's probably not even enough relief for some. I had a conversation with a teacher at Mountain View just the other day who's doing a phenomenal job with asynchronous learning. But if he told me, and I've known him for a while, if he leaves before 8 p.m., he's had a good day and he's leaving early. That's not sustainable. This isn't enough by itself to turn the system over. You're not going to all of a sudden change everything by adding a couple of hours of prep time on a Monday. We have a committee that met for the first time today that's built with principals and academic coaches and all sorts of folks talking about what should be, now that we've lived in this remote world for a few weeks and we've kind of started to see what are the problems, what are the solutions, what are the places where we're seeing it done really well, to create a new, for lack of a better term, banks of the river in terms of what should remote learning look like. How much live instruction, synchronous live instruction, should a teacher do? Do they have the necessary tools to do that? So you talk technology, you talk about all of that. What additional training do they need to pull that off? Those are all things that this team is working on. Got a lot done in one meeting today. We have another meeting on Thursday to dig that in more, and we're going to continue to work until we have something we can give to our building principals and our teachers to say, this may help to focus teachers' time even more on what that remote learning looks like. But the reality is 56 schools, we can publish all the guides and documents we want. It doesn't change anything until the teachers have time to dig into it and actually start talking to their colleagues, planning and building those new lessons, planning and building it and thinking differently about how they're going to engage their students. And this was the only way we found that we thought we could build some time in for teachers, give them some relief, without also sacrificing all the instructional hours that we need to meet the requirements for the state. So hopefully that kind of answers the question.
Thank you. I think my last follow-up, and it might be for you or for Mr. Rice. The really unfortunate part of this right now is we've got teachers who are emotionally stressed and we've got parents who are emotionally stressed. And this decision point right now is between who gets the emotional stress relief and who takes on more.
Correct.
And I'm challenged by that. I'm struggling with that decision because I don't have anything right now that says directly to parents, here's the plan and how we're going to get there. How would you respond to that?
I think Mr. Rice did a nice job of saying there's not a quick answer. I don't think these folks, a lot of these folks to my left, have spent their entire adult life learning how to do this job. And now they're being asked to do this job in a completely different way, and while also combating their own conflicting feelings about comfort and safety. And you know, usually if a student's struggling, I'm going to get down on my knee next to him and I'm going to work right next to him shoulder to shoulder, and now I don't think I can do that anymore. And that's, when you're a teacher, you're a perfectionist. You want to do the job to the highest level. And some of the things right now are forcing teachers to make sacrifices or changes to how they do their job that they're not even comfortable with, but they also feel like they have to protect themselves and their family. And so there's no easy answer. I think the answer is, like we always do, is we're going to give teachers as much time as we can, give them as much guidance as we can. We're going to roll up our sleeves. We're going to continue to work together and try to do a better job every day. And I would also argue, and this is, I think, for everybody, is when a parent contacts me and says, my teacher at such and such school is not doing a good job in remote learning, my response is, have you spoken to that teacher yet? Have you then spoken to your administrator at your building yet? Because that teacher by teacher, building to building, that's how we're going to improve. It's how we've always done teacher growth and improvement, is working individually, teacher and teacher, coach and teacher, administrator and teacher, working together and saying, here's an area where we think you can improve, and let's give you the tools and resources to get there. And Unfortunately, I think we want this to be fast. We want to turn from being an in-person learning environment to this remote environment, and for it to go quickly. It's probably not going to improve. But I will say, since the first day of school till now, I've seen great improvement across our system. Still not perfect. We still have inconsistencies, but I've seen great improvement, and I know we will continue to see great improvement because we have the people with the abilities. They just need the time and the tools and the resources, and also maybe just a little bit of the grace to know that we're asking them to try some things that are hard, that they've never done before, and they're going to make mistakes. And we need to give them some license to make some mistakes and try new things and know that it's not always going to be perfect. And teachers are always their own hardest critics, but I think we just need to give them some time. And I would struggle just like you are to answer a parent to say, by doing X, Y, and Z, all your problems will be solved. It's not going to be that easy. But I know that principals already have worked with individual teachers and found ways to help them improve what they're doing and given them tools, and we've seen improvement. And that's how we've always done that improvement process with teachers, and I think it can continue. I do think it's part of what's driving, though, the people out there in the world who say you should be in school 5 days a week, every day, no matter what the color category. Part of what's driving them is they're not necessarily seeing, for their own individual student, the remote learning improve to the level that they think it should improve at the rate that they think it should improve. So it's clearly something we have to continue to work on. I just don't have an easy magic bullet to say it'll be all better in 3 weeks, because I just don't think that's, I would not want to go out on that limb right now.
Yeah, sorry, and Brett, I wasn't asking you,
Yeah.
or Mr. Howard. I think what I was looking for was a roadmap to get there, and that's the piece that I'm not sure is clear to me yet. The other, I guess I did have one follow-up, sorry, Mr. Chairman. Have we considered at all just video connecting our classrooms entirely across the district?
So when you say video, so, you know, I think if you're asking just for flat, live, synchronous instruction, is that what you're talking about?
Yep.
Yeah, we are looking at what are those tools that we would need to put in a classroom to allow a teacher just to teach live, and there are teachers doing it. Some of them are doing it with a shoestring budget of things they've thrown together. Yeah, we have teachers that are doing it, that are teaching live. I've gone and visited some of them, and I keep asking if there's others that I can come visit. I want to see it, and so we're taking notes of all these different ways that teachers are being creative. A lot of them are just using the tools they already have at their disposal. Some have gone out and spent their own money to find ways to do it. We are looking at what are the tools the district could purchase and just systematically put in the hands of every teacher. I would argue, and we talked about this a lot today in our group, what I don't want to advocate for is that students, from the time they start school in the morning till the time they walk out at the end of the day, are just watching a video of what's going on in class. And that we, though that'll feel better for some people, it won't necessarily be the best thing for anybody. There needs to be a mix. There needs to be a blend of things for a student and for the teacher. And there's some things you just can't replicate that you get in a classroom that you would try to do at home. And so trying to find that balance is where we're trying to get to. I do think that this subgroup that we are working on will help to provide some of that roadmap of here's the things that we really need you to take out of your playbook in terms of remote learning. These are some practices we need to maybe stop doing. Here's some things we need to encourage you to do more of. We've already started capturing videos of some of these teachers who are doing some really good things with synchronous and asynchronous learning. So videos of watching them do it, interviewing them on what their setup is and how they kind of use it, that we can then promote and push out to our staff. And so I think those practices, much like they've always been, will be things we'll continue to do. But yeah, that roadmap is, you're sure it'd be nice if we could have a really clear roadmap with signs and where we stop and where we evaluate, and I think we can build some of that. I think the first step is this task force that's doing that work right now to say, what should remote learning look like? And we built one of those early, but I think one of the things is, we built some guides to yellow and red, but we hadn't really done yellow and red. And now we've done yellow and red for a few weeks, and so we're starting to identify, well, we need to maybe erase some of these things off the list because they're not such good things, and we need to add some things that we hadn't thought of before and that our creative teachers have come up with. So we're trying to learn from the best of our teachers that are doing some really good work and add those to this playbook to allow teachers to have some guides to get them there.
Mr. Chair, I apologize, one more.
I do need to get going, I'm sorry. We have some people who are waiting, and we've spent quite a bit of time.
It will influence my motion. Okay,
more
this will
level.
just influence the motion I'm thinking about, so that's why I'm going to ask it, if you don't
If
mind.
you can keep it short, please.
Yeah. Who's the membership of the task force you're speaking about?
So as of right now, we have some building administrators from all 3 levels. We have some curriculum coordinators and some academic and instructional coaches. Some members of the district administration team are on there. Digital integration team is on there. Jonathan Gillen is on there because we know we're going to probably be asking him to spend some money in order to do some of the things we need to do. We talked about bringing classroom teachers into that team, but I'll be honest, part of that issue is we can't overtax our sub situation as it is right now. And so one of the things we've talked about is once we kind of have a first draft of a document that we think might be helpful, is to get it in the hands of our teachers and get some feedback from teachers. But we didn't want to pull teachers out of their classrooms right now and asking teachers to come in after hours. We already have spoken about the amount of time after hours they're using to prep for their own classroom. So right now we're just trying to be really sensitive to time, but I also think there is a value in having teachers from every level involved in this process.
Excellent, thank you. Mr. Heller, I'm assuming this covers then 3 and 4?
And there's a little bit more if you don't mind.
A little bit more,
Mr.
please, okay. All right.
Yes, sir.
And if you don't mind, just for the audience's sake, I will have time. We're just going to make it, what I thought is maybe finish Mr. Heller's presentation, and then we'll go into public
Well, I
comment.
have a feeling that much of the audience is here to speak on maybe the parts that I'm about to talk about. Okay. So again, if this idea of a red operational schedule change were to happen, again, we would be asking the board to approve that Monday be an asynchronous remote day if we were utilizing an alternating day schedule in red. So I'll talk more about that at this time. I'm going to go back to this bullet because I do think, just for everybody's, for us to just continue to talk about it, we will not be able to meet and guarantee those physical distancing measures even if we do an alternating day schedule. So I just continue to want to make sure we're all clear on that. So you're all familiar, I think, at this point with these colors. And this is a draft that our COVID task force has looked at, and other teams in the building and the district have looked at, and would now be something we would have the board consider as well. As you can see in yellow under this, K-5 daily in-person learning 5 days a week with Monday early release day, with 6 through 12 alternating day in-person learning with Monday as an asynchronous remote day. In yellow, we would be using the CDH cases per 100,000 of greater than 3.0 but less than 20.0. In red, you can see we've broken that red category out in cases per 100,000, 20.0 to 34.9, that idea of K-12 alternating day in person with a Monday asynchronous remote day, and greater than 34.9 full remote learning. Now, I'm going to tell you, there is not, I don't have any magic as to why these were the chosen metrics. When CDH talked about this idea of lower levels of red being in support of some level of in-person learning, Gina Pinnell said, for example, maybe we'll get to 30 or 34 or 35, and that becomes the area right where we feel like we can't do in-person learning anymore. I've shared this with CDH. They have said, this is fine if this is something you guys want to do. These metrics may not, in fact, be the right ones. We don't know really either at this point. What point do the metrics get high enough that they start to create an overwhelming of the health system? Those are things that they're going to be watching as well, and they made some of the guidance to allow some in-person learning because right now in talking to their hospitals, they're feeling like they're okay, I think was the word they used. Not great, but they're okay, and so they felt like they could support some in-person learning. Now, I will go back and just continue to say that in-person learning that CDH is supporting in red is with those consistent physical distancing measures in place. This slide just gives a little bit more detail in terms of what we might see happening in yellow, green, yellow, and red, in terms of family expectations, face coverings, teacher staff expectations, busing. Nothing in here that's necessarily new information, just maybe presented in a new format by color category. Give you a chance to maybe look at that real quick. for the sake of time, click through, and if we need to come back to this, I'm certainly willing to. So a timeline for this change, again, we would say no later than Monday, October 19th, because CDH has made the designation of red today, where all schools would begin this implementation of Monday being an asynchronous remote day and Tuesday through Thursday being an alternating day. And if this was approved by the board, then we would begin communication immediately with staff and parents. So I'm going to stop there for a second. Questions from the board on that particular portion of the presentation?
Trustee Newhoff?
Has what you just proposed to us been subjected to legal review?
No, we've sent it to CDH.
Okay, so here's where I'm going to go with this. I mean, we've heard all about we can't be as transparent as we should because of FERPA and all these legal considerations. What about the gross negligence consideration that puts us at significant liability exposure, even irregardless of what the legislature did?
We can certainly reach out to them and have them review that, Trustee Newhoff. That would be, I think it's a good suggestion for us to do. And especially, I mean, again, if we are saying without the ability to consistently implement physical distancing measures, I see where you're, yeah. So that's something we can certainly reach out and do.
Trustee Johnson? Sorry.
Sorry.
Oh, gotcha. Trustee Ozuna, please, I'm sorry.
We haven't had all of our students remote synchronously since we tried that the first week of school. What do you know about what our technology can handle today? Because I don't think we haven't been able to test that since the fix because, you know, we're hybrid.
So I'm going to, Trustee Ozuna and Chairman, I would say you're asking me to walk out on a, maybe, in talking to Mr. DeLashment, our filtering issues, we are seeing a greater level of ability of bandwidth. It's not completely, we're still seeing glitches across our system. You talk to teachers, they're still having situations where kids, for reasons unknown, don't connect on a day and things aren't working. He believes that our system can completely handle, we asked the question the other day, for example, in this idea of synchronous learning. If we went to a full synchronous learning process and all of our students in red were all watching live instruction at once, do we have the bandwidth to handle it? And he said, yes, but we haven't tested that in terms of, the only way to sometimes test things like that is to do it, and you can't mock test 40,000 students plus staff all getting on live at once. It's really, all of our providers are saying yes, it will work. I think we all have some concerns with technology in general is finicky, and we know that we're going to have some issues where students just aren't able to connect. So
Mr. Chairman, a follow-up to that. How do we move forward with a plan, even with this remote Monday idea? How do we move forward with something like that where our ability to get our students to connect is critical without doing a test? How do we get that test done before we were to implement something like this? Because we can't re-experience that problem.
I would be open to any suggestions that you have in regard to how to test that for 40,000 students. And Devin, if he were here, I'm sure he probably has an idea. We can certainly, I'm open to any ideas that we have. I think you're right. There's always going to be a challenge there of how do we know for certain. I think I've said this before in these meetings is I think we're all hoping for some certainty in the most uncertain of times, and this is again one of those things where if we're saying today's a synchronous portion of the day, you're all getting on live, will that work and will everybody get on? I will say though the synchronous live instruction that is happening, we are seeing less and less of the internet issues, less and less of the filtration issues causing us problems. But I will tell you that Devin and his team had a 4-hour in the middle of the night emergency this week that they were trying to solve. So these things are going to continue to happen. I can't say enough about how hard they're working, but I don't have a great answer on how how we could test our system in a way that gave us great confidence. I think back to, I think Trustee Smiley is, the smaller the sample size, the less you can generalize that data across the system, right? And so with the only way, we were able to generalize really quickly what the problems were on the first day of remote learning, because we really quickly had a large sample size of problems. Our sample size over the summer clearly didn't give us enough information that we were able to generalize that across our system, and we didn't know the issues existed until we knew they existed. So I don't have a great answer other than Devin has told me he feels very confident that we're in a much different place in terms of our ability to connect all of our students at once now because of the changes they've made to the structure of the filtration systems that were causing the problems.
When I think through what that might look like if we had a problem, and for the kids that experience the problem, I think it's pretty traumatic and they get behind. Education continues without them. I mean, there's lots, right? It's a problem. So for the kids that experience that, it's a real issue. So if we were to try this, if we were to move ahead with this plan, and we have the afternoon remote learning day, and it goes poorly, we don't try it again until the next week. And then, you know,
Sure.
and I think part of what helped him work through that is that they were discovering things every single day because we were continuing on every day. So I'm a little bit reluctant in an approval here that without some assurance that we're in a better,
Sure.
that we're better, some assurance that we're going to be okay there.
Yeah, and I don't know that I'm going to be the one that's going to be able to give you that assurance because I can't speak as well as he can on the details that he knows in terms of that. I would say we can certainly ask him to provide some of that to you. That's not going to help you tonight to make a decision. So,
One clarifying thing then, with the K through 5 early release, they do not get back online synchronously?
correct. That is correct.
They're off then for the rest of the day?
That is correct.
Okay, thank you.
Can I, do you mind if I just clarify an answer to that question for you? Yes, they're done when they would leave for the day. Originally, our plan had elementary having a remote learning day on Monday and then going 4 days a week full-time in yellow, so 4 days, full day. That, we got enough feedback from elementary folks that if their kids are coming to school every day, they might as well be in school every day, and adding this asynchronous remote thing on Monday might actually increase our actual amount of planning we have to do, so kind of counterintuitive to what we were trying to solve. So today, one of our elementary principals brought this idea forward in the COVID task force of I've been talking to other principals, what do you think about this idea as an option for elementary? We crunched some numbers and said, let's take that forward to the board tonight. Yeah, it was the best next option we could think of to help those elementary folks still get some time without having them give up the in-person learning that they are already doing.
Trustee Johnson.
Thank you. And Mr. Heller, you may not know the answer, but I'm going to ask it because having been through some pretty significant system implementations in my life and where we've had 100,000 users on them on the first day, have we reached out to other school districts or other technology experts and asked how we could possibly load test or test and build in the testing process to those systems, or have we, have we reached out and tried to get some expertise to help us?
So Trustee Johnson, I would say that I don't know that answer for sure. I know that Devin has been in many conversations with other districts, many of whom were using the same filtration system that we were using, bigger districts than us, to find out if they ran into similar issues, and they weren't running into similar issues. So that led to some of the puzzling, how do we find solutions when other districts aren't having these same problems? In terms of, has he had conversations as far as load testing and some of that? I don't know the answer to that, but I can certainly ask him that question and have him reach back out with that information.
Okay, thank you. I think in your answer, I learned something pretty quickly is if other schools that have the same system as us and have the same issues have the same size, aren't having the same issues, we've got an issue somewhere that we probably are going to run into again.
And I would say that we did find most of the reasons why there were the problems, and so those things were fixed and they made some choices. But yeah, there were times when the vendor that we were working with said, we've never seen the system handle itself the way it's handling itself now. So there were seeing some things that were different. They believe they fixed all of those problems, but to the point, can we say that with 100% certainty? I don't know that we can.
Thank you. And then my last question is, if we haven't, have we considered a rollout schedule that would allow us to test it?
We've talked about all sorts of things from this not even going into effect until second quarter. We had all sorts of conversations. I would say that's something for the board to consider if they wanted to not necessarily start this K-12 on Monday. I think that's something that we'd be open to any amendments or changes that the board might want to make in terms of a different rollout schedule so that we can build in some of that. I would say we'd be amenable to any of those changes if that's something the board would like us to think about.
Trustee Ozuna?
I'm sorry, Mr. Hellard. I must have just caught onto this. So the plan that we reviewed before tonight, this was going to be effective for second quarter. What you're proposing now is that this becomes effective on Monday? A change to the Team 1, Team 2 days with Monday, the remote Monday, effective on this coming Monday?
Yes, Chairman,
Sorry.
Trustee Ozuna, I know it's, believe me, trying to put this together was even a little bit complicated at times as we went through changes. The discussion is, since we are in red, so initially our plan, was a remote day in yellow was the original plan I think we put forward to you guys. It was a remote day for yellow. Well, we're in red now. And so conversations quickly escalated with, should we be implementing more of a in-person learning model in red? And that's something for the board to take action and decide upon tonight. If we're going to do alternating day in red K-12, then the discussion was, we need to add this remote day in red during the alternating day, so our teachers do have that time still built in for their planning and preparation so that they can do what they need to do on the alternating day. Again, all of that is really up to the board to make some decisions on. First, I think the decision is, does the board want to consider in-person alternating day schedule in red? I believe there's lots of people here to speak about that particular topic. If so, do we want the Monday remote asynchronous day to be part of that alternating day schedule in red? Once we get to yellow, whenever that may be, the yellow version of this plan would go into effect then. My guess is that will be after the start of second quarter based on our current timeline. So once we move back into yellow, whenever that is, we would begin the yellow version that I presented to you tonight. Does that answer that? Maybe.
Can we have a copy of this so that we can look at what that schedule it was on a couple of these slides, but Sherry, is that possible to just print us a copy so we can look at that while we're listening to the testimony?
Yeah, I think I can get that done. If we want to take a break, I can get some copies made.
That might.
So I guess I would ask, the next few slides, and I'm gonna rely on maybe the chairman and the board to kind of give me some guidance, given our time. There was a request made for us to talk about a potential timeline for sometime in the future where 6 through 12 could attend more daily instruction than they're currently attending when in yellow. Is that something the board wants us to discuss tonight, or do you want that to move into the October 27th meeting? I just want to value everybody's time. We have a lot of
I think our teachers are working a lot of hours, and we can stick around until we need to get it done. That's my opinion.
Okay, I'll move through these quickly, and we'll then, I can make some copies for you all. So again, some conversations, and everybody in the room knows how much the conversations that are out in the world about K through 12, specifically 6 through 12, attending to more school in person. So district admin has talked a lot about this. Our COVID task force has talked a lot about this, and we would say we would not recommend anything for in-person in 6 through 12 on a daily schedule starting any earlier than February 1st. Part of that is that families and staff made decisions about their comfort level for in-person learning based upon the original plan. There are no current online remote options for parents to transfer their students into. Virtual Schoolhouse is currently at capacity. We have been informed that all the other online options out in the community are also at or very near capacity. One of the arguments that I hear from the folks out in the world who want us to be in school all day, every day, K through 12, is we've given our parents choices. And while we did give them choices, there was a point where that choice closed and we couldn't take any more students. So any changes we've made between now and then, there are families who feel like they made a choice and now that choice is different than what they would like to select for their child now. And we don't have a great option to give them. So we've said that any type of drastic change for K-12 to attend in person daily, and specifically, I guess more specifically is 6-12 to attend in person daily, needs to be combined with an opportunity for families to consider moving to a fully online option. So for West Ada, we feel like to meet the needs of those students and staff that have concerns over this change, we would want to open up a declaration period. We would say like October 28th, that would open up where parents would have to go in and actually declare, I want in-person learning, or I want the in-person learning 4 days a week in yellow and the alternating day in orange, or I want full remote learning. They need to make some choices about what they want to do. So then if you think about the movement of that, if we do that through December 1st, that gives us really 4 to 6 weeks really to make a lot of changes to our system in terms of what staff need to potentially move to virtual schoolhouse to accommodate new students, the scheduling changes that need to happen to balance all of that out and to do that well, and then also provide some additional PD to virtual schoolhouse teachers. And so with that, we don't believe that making a change for all students to attend in yellow on a daily basis should happen anytime before February 1st so that we can create that declaration period. Now in terms of what it might look like, again, very much a draft, is perhaps it's something more like this, where yellow is that daily in-person learning K through 5 days a week with the Monday early release, and 6-12 alternating day in-person with Monday asynchronous. I apologize, that's inaccurate. This 6 through 12 should say daily in-person, so not alternating day, if we were going to make that move. Orange becomes the alternating day for all students 6 or K through 12, and then red is the full remote learning, and you can see the cases per 100,000 metrics that are being used. They're very similar to what we were proposing in our current adjustment to the plan. Again, breaking out some of the operational pieces, and again, this would be the timeline if this is something the board wants to pursue, to give our students and staff time to make some choices in terms of their comfort level instructionally, safety-wise, for families to make a move, and for us to actually be able to accommodate those moves. So those are all of my slides.
Excellent. Thank you
Lots
very
of
much.
information.
Thank you very much, Mr. Heller. And I truly appreciate everyone's patience with us as we just kind of explore some things that are obviously new. We've got lots of good questions. At this time, I would like to open it up to comment period. And what I'll do is I'll ask members who have filled out this form, and Clerk Newbold, have you collected all the forms? Are we completed? Okay, great. So there might be some additional, but what I'm going to do is ask you to come up. You'll get 3 minutes to, and you'll see the big numbers on the wall, to be able to speak. And then at the end of 3 minutes, if you would just close out and then sit down, it'd be wonderful. When you're standing, please make sure when you come to the mic that you say your name, and if you would, your school. That'd be wonderful. And we'll start off with Kristen Sepnas. Christine Sepnas. Thank you. I apologize if I misspelled or mispronounced your name.
Okay. Thank you, Mr. Chairman and fellow trustees, for the exhaustive work that you've been putting in. My name is Kristen Sapnis, and I teach life science and zoology at Heritage Middle. I've spoken with many teachers, coaches, and staff at my school, and have heard concerns from representatives at other schools. It is very revealing how teacher health and safety is viewed given the results from the parent survey. A key flaw in their argument is comparing teachers to nurses or grocery clerks. It is the sheer number and proximity of our students, exposure, time, and location is just so vastly different. We're seeing 80 to 90 kids in a day now, doing our own cleaning in small rooms with lower ceilings, no windows, and insufficient airflow. Our classroom isn't as big as Albertson's, and we don't have hospital-level sanitation or PPE. Secondly, and critically, our numbers are increasing because of sports. Coaches have serious concerns too, and that hasn't been brought up at all. If you saw locker rooms, buses, practices, you wouldn't even think that we were in a global pandemic. We need to think of them as students first and not student athletes. If they become ill, get a friend, family, or teacher sick, or have to quarantine, now their academics will suffer. I get that sports are important to many families. Teachers' kids play sports, but some of the pushing from the start of the school year felt to us that the priority was sports. And if sports were so important, then as a community, we should have been willing to rally together and continue to do the necessary basics, like wearing a mask over both our mouth and nose. I say nose and sanitize dozens of times every day. Numbers on the spreadsheet, which you have addressed, show that those school cases are wildly inaccurate. So if CDH parents and the board have been using that as guidance or evidence, then we're in trouble. Teachers, support staff, nurses, and admin know that those are definitely not up to date and correct. Especially now that we're in red, the CDH's illness decision tree is going to lead to a cascade of problems. Now in category 3, a student or staff with just a sore throat or a headache automatically must pass go and into isolation for 10 days and or follow health provider and school guidance. And this is different from the draft that was shown tonight in red. So if teachers, I'm going to skip around, time is short. If teachers, or God forbid, our nurse needs to quarantine, we have no nurse subs. Minimal subs for teachers and can only fit so many kids in the library to be watched by the librarian each period. We love our kids. Teaching is my identity. This meeting was reassuring. Thank you, Mr. Heller. But my teachers' friends have been in tears and terrified that we could be crammed into a full class in yellow in that second semester if everything gets shifted. I cannot bear thinking how many of them would just choose to leave. We give our lives to teaching, but we don't want to lose our lives to teaching. Thank you for your consideration.
Thank you very much. Ms. Sue Darden.
Chairman Klopfenstein, members of the board, Dr. Reynolds. My name is Sue Darden. I'm a teacher at Galileo STEM Academy, and I'm concerned about the possible changes to the district plan for education when Ada County is in red. This is my 31st year of teaching, and I love being in the classroom with my students. I want to teach. I want my students in the classroom with me, but I need to feel safe doing so. I can honestly say I have never started the school year wondering if I would be alive at the end of it. As a board, you came up with a plan using data to determine when we would be at each color level. Now that data may be disregarded, which is making me feel very insecure. What would it take for me to feel safe? Honestly, one of those things may be out of your control. I do understand that parents who want or need their students to be in school. What I do not understand is why these same parents are refusing to have their students wear masks that would keep us all safer. When our forefathers wrote the Declaration of Independence, they stated that we all have the rights to life, liberty, and the pursuit of happiness. The first of these is life. Studies are showing that most, but not all students, have a little negative impact because of the effects of COVID. However, the same is not true of many of us veteran teachers and staff and our family members. I do not see a constitutional right to not wear a mask, but you do have the legal and moral responsibility to allow us to have the right to live through this year. I do think there needs to be a real discussion about the medical exemptions given to students to not wear masks. I understand that for students with a diagnosis of being on the autism spectrum or having other sensory issues, a mask can be a real problem. However, exemptions from a medical professional who injects Botox or a chiropractor really concerns me. I would like the board to have a serious discussion about the use of face shields. I know they're more comfortable and popular among students and even staff, but they do not come close to providing the safety that masks do. I have numerous conversations with elementary teachers who are concerned that they're spending time with 30-plus students with no space in their classrooms. The problem is exacerbated when the students take off their masks 3 times a day for snacks and lunch. This puts these teachers at even greater risk. You have a lot of dedicated, caring teachers in this district. We want to teach, we want to do what's best for kids, but we also want to keep ourselves and our families safe. Please help us do that. A few weeks ago, I was talking to a distraught teacher, and it broke my heart when she said, "Sue, I don't want to die." Frankly, neither do I.
Thank you. Ms. Cami Scheller.
Carmi Scheller. I teach at Star Elementary. Sorry, Sue got me. Thank you for your time tonight and your deep consideration of all the opinions and information you have in front of you when deciding to change the plans for returning to school. We follow color codes for many reasons. Universally, green means all clear, it's safe to go ahead. Yellow is caution, you may be able to continue, you may need to halt or turn back. Red means stop, it's not safe to proceed. While we have been in yellow, case numbers have gone up in our community and in our schools. K-12 cases have doubled in Idaho based on bad data. It's probably, I'm not going to go there. The White House is suggesting a link between schools reopening and outbreaks in the communities. When our community is in red, the schools should be remote. That's what the plan said when staff and parents made their decisions to return to this district. We also decided to return based on yellow, meaning hybrid, teams that increase the school's ability to adhere to safety protocols. My school is doing an amazing job of adhering to safety protocols, but now that I have 24 students in my room, I spent the first day explaining to them how the seating was going to still provide this protection that they had had when they were in teams, because they asked me to explain why it was all of a sudden safe to sit the way we were sitting. And I did a lot of research to find the best layout I possibly could, but they don't feel safe. And they trust their teachers, and I did my best to explain it and to make it where they understood, and mathematically and with diagrams showed them, and it makes sense, but it still doesn't come close to meeting what CDH says we should be doing with this number of students with distancing. If the red plans change, then protocols must be tightened for students and staff safety. Masks only, no shields. As the CDH has clearly stated, shields are not a replacement for masks. Cap the class sizes. They need to be in a size where we can adhere and maintain. This year I have 24, last year I had 36. My colleagues in 5th grade are at 33. We're getting new students every day as things change in our community, as remote doesn't work for them. And it is making it more and more challenging to continue with the protocols. While changes were made to the liability law regarding limiting liability for school districts, it does not provide immunity from acts that are willful or reckless. Even in modified red status, CDH is still instructing schools to implement social distancing. CDH is also instructing schools to slow reopening plans. You've stated as a body on multiple occasions that you'll follow CDH guidelines and recommendations. Please continue to do so.
Kelly Reed Hewer.
Good evening. Even though my father was chairman of the school board where I grew up, I'm not sure how to address you all, so good evening. I want you to think about something, not just as you listen to me, but as you listen to the other teachers talk. I want you to hold this in the back of your mind. I want you to think beyond how it affects you and your children. I want you to think beyond how it affects our students, and I want you to think about how it affects us, the teachers. While Mr. Heller was speaking, I heard many questions about the technology. I did not hear a single question asked about our health. You were not asking questions about our mental health, about our physical health. part of your job is to protect us as much as it is to protect our students. And we are feeling very let down. We are feeling ignored, disregarded, tossed aside. I had a parent once who said that essential workers were really expendable workers. She was an essential worker. A lot of us teachers are feeling that way right now. Our classrooms are not big enough. I work in a portable. I have 20 kids in there, and this is on my alternating days. I have 20 kids in there. In a portable that's barely the size of a medium living room, I'm supposed to keep them 6 feet apart and stay 6 feet away myself. I'm not so concerned about the tech. That'll figure itself out. What I want to know is what you're doing to protect me, what you're doing to protect my husband, what you are doing to protect my grandchildren, and what you are doing to protect your own children. I don't need the rest of my time.
Ms. Reed here, I apologize. What school were you from?
I'm with Rocky Mountain.
Rocky Mountain. Thank you very much. I just wanted to make sure I asked. Next be Eric Thies.
Good evening. How are you guys doing? Trustees and Chairman, Dr. Reynolds. Usually I come with prepared statements for you guys, and tonight I'm not sure exactly what I want to say, except that every one of these teachers are going to be talking to you about their real life and their experience, and every one of them I know wants their kids in their classrooms. But they want it to be done in a way that's going to keep both the students and themselves and their families safe. There's teachers in our district who are in high-risk categories, who have spouses and they're caregivers for folks that are in even higher risk categories. And they go home during the day, they have panic attacks in the hallways because a kid takes his mask off. There's tremendous fear and there's tremendous risk. And we're not addressing those concerns well at all as a district. And that needs to change. But right now, what the decision that you're trying to make, or one of the decisions you should be making tonight, is whether we should bring back kids in red or if we should stick to the plan that we have that says red is remote. And the CDH has given you permission to do that with a caveat that you follow some guidance, and one of those guidance pieces is that we physically distance. And that's simply not possible in most of the classrooms in our district. There's simply too many kids and not enough space. We also have students who at every level, whether it's their parents or them, who simply refuse to follow the protocol. We have staff members that we work with that fail to follow the protocol, and it's failed to be enforced. There's real issues that need to be addressed to make teachers feel safe so that the panic attacks stop, so that they're not crying when they're going home at night. And I know that's true because they call me up and they talk to me about it, and it hurts, it breaks my heart. And now there's an idea that instead of taking care of the issues that we have and protecting and supporting the staff that make this school district run, that do the most important work that we do, we're just going to increase the risk, and we're not going to have solutions for all those other problems. I believe there's two solutions. Sorry, one solution in front of you. No, two. There's two solutions in front of you today that I think will help with that. The remote day Monday will give them some time to get some work done, to collaborate with their colleagues, and we need that. That's something teachers are missing this year because of COVID. The second item is some knowledge about how bad COVID is or is not within our district, and we need that as well. But we need more time to find more of those solutions to help our teachers emotionally handle their job this year. And moving away from remote and red is not going to do that. So thank you very much for your time tonight, guys.
Thank you. Morgan Marshall.
Thank you. I am Morgan Marshall. I teach at Meridian Middle School. Mr. Chairman, trustees, and Dr. Reynolds. Thank you for allowing me the opportunity to have a voice in the academic schedule modifications you are considering tonight. As an educator, I recognize that moving to an alternating schedule in red will provide some students with the social, emotional, and academic support and stability they need. However, I want to focus on the reality of the situation as an educator currently trying to teach in this pandemic. I want you to consider a few things before a new decision is made for the students, families, teachers, and staff of West Ada. The first is the constant changing of pandemic plans is extremely challenging for students and teachers. Revising lessons plans, unit plans, and curricular goals and materials without adequate notice or planning time has had an enormous impact on my personal life and my professional life as well. It would be incredibly helpful to me, my colleagues, my students for the board to make a decision about in-person and/or remote learning well in advance of its implementation. For the record, Monday's not going to cut it. So make the decision and then stand by that decision through the wave of reactions that our community will inevitably vocalize. I want my students in my classroom every day. That's why I became a teacher, is to help students. I know they have more opportunities to learn and engage in equitable and collaborative ways when they are in my school. I teach math. However, now may not be the time to prioritize that. I've had multiple absences in every single one of my classes every single day due to COVID confirmations, exposures, and quarantines. This is very difficult physically, academically, and socially for the students directly affected by COVID, but there's another concern here. I and all of their classmates have been exposed to this virus from inside the walls of my school. While facial covering, sanitizing, and physical distancing practices are in place at my school and in my classroom, I still wrestle with the everyday thought of contracting the virus myself and being a source of community spread. I constantly wonder what would happen if I contract the virus. Who is going to teach my classes? Are my students going to be okay? Are they going to learn the curriculum they should be learning? Am I going to recover? What is this going to do to my family, to my kids at home? And is everybody going to be safe in the end? Because we don't know the long-term effects. All of these worries and anxieties make it much harder to focus on teaching, which is what I desperately want to do. If the CDH put us in red, that means the rate of community spread is high. The only way to reduce community spread and the many anxieties I've shared with you is to reduce the contact with the community and the means in schools. The last one is I would like to remind you of one of the goals of West Ada School District is the safety of students, parents, and staff is foundational in an educational system. West Ada School District is committed to providing and maintaining safe physical, social, and emotional conditions which promote a healthy learning environment. So please think carefully about the students, the teachers, and everybody that will be affected by your decision. Thank you.
Thank you. Ann Biason?
Hello, I'm Ann Biason from Meridian High School. Even at high school and even with half the students in our classrooms and hallways, we're having some difficulty keeping students distant, not touching each other, keeping their masks on, keeping things sanitized, and a whole lot more. We're having a rise of COVID cases even with half our students in the building at a time. It's not safe to bring all the students back in the school building on a daily basis to try to keep them distant and with their masks on, not to mention the extra sanitizing that would need to happen, and not to mention all of our class sizes. In one class alone, I currently have a third of my students out of school with either illness or isolation, one class period. Bringing all the students back in the schools daily for middle school and high schools is not a safe environment in this COVID society due to the amount of traffic in the hallways, amount of students at lunch, the class sizes, the students who are arguing with teachers about wearing their masks, and more. These students move around the hallways going from class to class. They are not confined to one area or one classroom. I've been a classroom teacher for 14 years in middle school, and this is my 14th year teaching high school. I'm pretty familiar with the actions of teenagers and adolescents in the hallways and the classrooms. Due to the safety concerns of our students and staff, if the board decides to bring back all the students on a daily basis, there are many teachers who will need to leave their position for their own family's safety. Many staff members have health problems prior to COVID. Many have family members who are at high risk, not to mention the mental health issues, both prior and new. There are some teachers who have already had the doctor's paperwork ready to hand into the district office to go on a leave of absence if all the students come back on a daily basis. I've heard this from multiple teachers at my school. There are many teachers who, like me, with almost 28 years of teaching, have seriously considered leaving the career and students they love if they don't feel safe. Even with the reduction of students in the building and all the safety protocols in place, we continue seeing a rise of COVID cases and isolation cases. Please keep our students, families, and staff safe by not bringing all the middle school and high school students in the building together on a daily basis during this health crisis. Thank you.
Thank you. Jimmy Gonzalez.
Hello, I'm Jimmy Gonzalez. I teach at Heritage Middle School. I want to say that I'm a member of this community. I don't live very far from here. I also have 6 children, 5 of who are all in West Ada School District. So I can speak on behalf of a parent because I have 5 of them going here. And I'm also a teacher in West Ada. And as a teacher, I want to say that West Ada is well known for hiring amazing individuals who are great teachers and human beings. These are the people that 6 months ago were standing outside in 95-degree heat to have parades so they could say goodbye to their students, not because they had to, but because they love the children of this community. Currently, teachers are working harder than I've ever seen to try to bring quality education to our children in this challenging time. And at the end of the day, they look like zombies. And we walk by each other and we say, we're doing this for our kids, because we believe that. I understand that the science shows that children aren't as badly affected by this virus, and I know that there isn't much rhyme or reason as to who it affects and how it affects them, but I feel like putting kids in hybrid and red or having them attend full-time in yellow is really playing Russian roulette with not only teacher but student lives. I've chosen to enroll my children in virtual schoolhouse because I have a daughter named Ashlyn who has severe asthma, and we go to hospitals over getting a cold. And I couldn't risk that for her. I'm still teaching in my classroom, and I was okay with signing a contract knowing that you guys were going to move us to red, and that meant remote, and yellow meant this hybrid. But I feel that this move is putting me in a position where it's not if I bring COVID home, it's when I bring COVID home. And you are asking me to risk my livelihood for my daughter's well-being. I've sacrificed a lot to become a teacher, and it's because it's a profession I love and I believe in. And I'm standing here as a community member and as a parent with students in this school district and as a teacher to ask you to not make me sacrifice my daughter's health as well. Thank you.
Thank you. Lane Ward.
My kids are all grown. Well, my youngest is a senior in high school at Eagle High, and I teach at Eagle High. I forgot to mention that. And when I came to school this fall, I talked to my wife about things. We updated our will and all the other things that we felt we needed to do for the school year. And for me, it's a matter of risk analysis, right? And when we were in yellow, we had half the students come. And now that we're going into red, I'm just looking at risk analysis. I'm looking at numbers that are going up. Are they going up rapidly and dramatically? Some classes yes, some classes no. What I want to do tonight is tell you what I see. Because the CDH said, if we meet certain criteria, then you could maybe do the yellow thing in red. I have my classes spaced down as much as I can. They're about 4 to 5 feet apart, not 6. The kids are great. They're putting on their masks with a couple of exceptions, but the masks fall down a lot, and you say, I can see your nostrils. Can you cover that up, And but then lunchtime comes, and campuses are open. The freshmen are open campus, the sophomores are open campus, and they're walking down to the gas station, no masks on, tight groups, shoulder to shoulder. I don't even want to think what will happen with the traffic if we let everybody come to school and then everybody leave at lunch while these kids are walking down to the gas station. That's a scary thought for me. I had to tell I'm the meanest dad in the world. I had to tell my senior daughter, you can't go to a homecoming replacement party that's being hosted by parents who just feel that homecoming replacement parties just can't be done without because it's their senior year. We had a senior football night where the parents were in the stands. Masks were optional. But we had 50 kids or so down on the end zone behind the fence by the soccer fields, shoulder to shoulder, not a single mask. So between class periods, I see good things. In class, I see good things. Outside of class, I see a situation where the numbers are going to keep rising. And if we just ignore the numbers in the community, it's not going to get better. It's going to get worse. Thank you.
Thank you. And finally, Michelle Bonner.
Mr. Chairman, trustees, Dr. Reynolds, my name is Michelle Bono, and I am a 16-year employee of the West Ada School District, and I have been all 16 years at Meridian Academy. I'm very proud of where I'm at. I'm very proud of my school. I'm very proud of my kids. And my kids are holding up amazingly well, given this situation that we're in. And at our school, our kids need us more than you can ever imagine, because we are their safe zone. We are their, we are their place of safety. We are their place where they know they can come and they have a responsible, dependable adult that's there for them. Excuse me. My voice is shaking because I'm rather emotional about this, so pardon me. And I'm thinking about this, and I'm thinking how much I love my job. And I spent after school today with my staff, and we're all exhausted. We feel spring break tired. And it's not even the middle of October. But what we're doing is we're brainstorming every day, and I'm blessed to work with a small staff. And so every day after school, we're meeting, what could we do to do this better, to reach our kids, to help them engage more? And every day we collaborate, and every day we're there. And we're there because we love our kids, and we love our profession. Now, I have health risks. And all of a sudden now, this job that I love is something that I have to think about whether I can continue in. And I'm really sad because I'm good with my kids. I may not be the best English teacher in the world, but I make good relationships with my kids. And I'm saddened that all of a sudden I'm having to think about this and think about my profession and think about whether I can continue my profession that I am so proud to be a part of. But not only am I having to think about it for me, but I'm having to think about it for my husband, who was diagnosed with a blood clotting illness right at the beginning of COVID. So I have been living in a mask. I have been quarantining. I have been doing everything I've been asked to do because I love my husband and I don't want to bring something home to him. And now all of a sudden, I'm having to make choices and I'm having to think about whether I can continue because I might bring something home to him one day that would kill him. And you know, we talk about how everything is falling apart and how our kids they're falling behind. They're not going to make the grade. They're not going to make the score. And you know what? We're asking our kids to do school normal in the most abnormal time that any of us have ever lived through. And so maybe what we need to do is put the brakes on and think about this. Because you know what? We're not being fair to our kids. We're not being fair to our kids by not keeping a consistent message on what it is we're going to do. Thank you.
Thank you very much. That ends our, I beg your pardon, was there any? I beg your pardon, I didn't see a name. Let me, but feel free to come on up. We'd love to have you. Please. I beg your pardon, I'm sorry. I'm so sorry. We definitely have to have you speak then.
My name is Zach Borman. I teach at Rocky Mountain High School. Thank you, Chairman and Trustees. I speak to you today not only as a decade-long secondary teacher in West Ada, but as a parent of 2 small children currently attending school within the district, and with a 3rd little boy due to join our family in early December. I'm here to pose an important question, one that should be at the forefront of any leader's mind when considering a new policy proposal. What's the goal? Where's the destination? What's the big picture here? If leaders don't ask this, they're at risk of being deceived by short-term decisions that may provide immediate rewards but prove ultimately unsustainable and or utterly destructive. In our particular circumstance, I imagine that the larger goal of West Ada is the safe return of all students every day. So, assuming that the goalposts are not moved on us again tonight, that leads us to the logical conclusion that we should only be adopting policies that lower the spread in the valley to the point where the CDH can degrade the level of risk to green. I want to be clear with this next point. There is no way that continuing in hybrid in red gets us anywhere closer to green. No way. None. To think it would is to engage in magical thinking. In fact, maintaining hybrid in the red is most certainly to do the opposite of getting us closer to that goal and more likely to increase our numbers in both the district and the county. For as much as we'd like to believe it's possible to maintain the social distancing and masking standards, the reality is we can't. As diligently as teachers may monitor our kids while in classroom, there will always be necessary or accidental lapses in the rules, and more importantly, many of the kids don't take this seriously. Even worse, many of the families don't. The truth is, even if we could control the schools entirely, the school does not exist within a vacuum. These kids come back to us with the illness and they'll spread it. The fact that we've moved back into the category of red today is likely due in large part to this board's decision to move forward with the hybrid plan in the first place. Continuing to do so in defiance of your teachers' concerns and or epidemiological science when the chances of contracting the virus are exponentially higher will lead us nowhere but to new heights of infection, quarantines, hospitalization, and most certainly deaths. What are you going to say to the kids when the daily super spreader events that you allowed lead us back to stage 1 shutdowns of the economy and their parents lose their jobs, their businesses, their homes, or possibly their lives? If you move forward with this now, you do nothing but extend the day that we can expect to actually safely get all kids back to the classroom. I have a 5-year-old daughter with asthma and a pregnant wife who is worried out of her mind for the health of our unborn child. The extra risks to pregnant women are pretty well established, but it's not clear what the long-term effects has on the unborn. My wife and I have no interest in being the pioneers of this new scientific frontier. I love my job. Every day I go to work feeling like it's important, and I would do just about anything in my power to educate, assist, and inspire them towards personal and intellectual growth. Anything that is except put my family and my own health at risk in order to do so. This virus is serious, it spreads easily and quickly, it has long-term effects on people's health, and it kills. As the elected representatives entrusted with making decisions not only in the interest of parents and students, but that of your faculty, staff, and the communities surrounding your schools, you must not move forward with this reckless and irresponsible plan.
Thank you, sir. Was there anyone else I had missed this evening or would like to speak? Excellent. Thank you very much. At this point, we're going to take another break and move into the action portion right after the break. So it's 7:15. Let's reconvene at 7:20. Sorry, 9. Boy, did I say that? I didn't say that. No. He's put. Just move ahead. You would like to? Would that be okay for the other trustees? Would that be okay? All right, great. Did you need to read through this? My concern is that you need to read through this. We just got the printout and maybe need a few minutes. Would you still like to go ahead and move forward? Okay, so why don't we just take, how about this, 5 minutes? And just in case, 5 minutes, reconvene at 9:25. Let's say at 9:25. Let's do that. Okay, great. I know we have a lot going on, but we have some more reading. So it's 9:24. We're going to reconvene and go back into session. And we're currently going into the action item D, or section D. First item on section D would be adjustment of red per CDH recommendation. Is there a motion? Trustee Johnson?
Thank you, Mr. Chairman. And maybe if I can ask Troy to pull up the language, because I think it's just easier to, this is not a small motion. So first let me say, before I make this motion, kind of what went into thinking about it, because I think it's really important to understand the why. I listened tonight to a ton of teachers, good teachers, great teachers, who have some very, very, very tough situations. We've listened to parents in the same boat. We've listened, the emotions of all of this is kind of overwhelming. But I wanted to kind of outline some teacher concerns and some parent concerns that have been common. So things of the why. Teacher concerns that I've listened to from common is stop changing things on us, stick to the plan. Enforce and ensure that all the safety protocols are in place and that medical professionals are involved in our safety decision making. We need more prep time, classroom tools, training time to get to a better remote. Those are the common themes. Common themes from parents: remote education isn't effective and we need more effective education for our kids. The safety of our kids isn't just dependent on COVID risk, it's mental health and social and emotional health. Please consider them all in your decisions. We want our family to have options. We don't want a one-size-fits-all plan. We want to be represented in the development of the details. CDH is not the decision maker, you are. Please consider more than CDH COVID risks. We don't want to leave our school community. We want options for virtual in our home schools. We want options for all day, every day in our home schools. Stop changing things on us. We made our decisions based on the plan and now it's changing. What are the common things? Because what I looked at in our survey data, in the testimony, and everything is we're starting to pit our teachers against our parents.
I apologize to interrupt.
I'm going to make the motion, Mr. Chairman.
Well, I think we can just pull back a little bit. Our protocol for presenting a motion is that we would present the motion and we get a second and we discuss it. So I think we definitely want to follow protocol. I'm also, so we're looking at adjustment of red per CDH recommendation. Could you just help me understand where this motion represents that question?
Yeah, sure, I will, Mr. Chairman. So first of all, I'll finish to say how this motion comes about. So this motion is looking for safety and operating plans for in-person learning, a pandemic plan that with a decision-making framework that's transparent and provides options for the best to meet students' needs, and it provides, I think this will be the next motion, but quality remote education and time to build it. So let me walk through the motion. So adjustments of red per CDH recommendations. First of all, here's the motion. For school operations, West Ada School District continue with the current hybrid operations for middle and high school and continue the plan for elementary school operations for the next 2 weeks and request the superintendent execute the following. First, a health and safety protocols validation. Using Dr. David Pate and other identified medical professionals, the superintendent conduct a medical review of district and school health and safety operating plans and current implementation, and provide to the West Ada School District Board at the October 28th meeting a summary of the review, the risks found, any additional health and safety actions taken or planned to remove variation, and implement the highest quality safety protocols and standards for the West Ada students and staff. This review shall also include any board actions needed to execute. Second, a framework for decision making.
If I could just interrupt one thing. Have you talked to Dr. Pate about this?
Yes, I have. Thank you.
And he's confirmed that he's willing to do this?
Mr. Chairman, point of order, if I'll finish the motion and follow protocols.
Actually, I'm looking at calling this out of order. And that's what my concern is. It might be falling out of process. So I just want to make sure that this is actually addressing this question.
Yes, it is, Mr. Chairman, and I have talked to Dr. Pate about it. I talked to him yesterday.
Have you talked to Dr. Reynolds?
Yes, I have. Dr. Reynolds got a copy of this motion this morning.
Oh. This is a surprise.
Okay, thank you. Framework for decision making. The superintendent will lead a committee that will deliver to the board on October 28th meeting a developed decision-making framework that can be followed for the remainder of the current semester, with only 2 adjustment options, one mid-year semester, which would be at the mid-year in December, and one at third quarter for the metrics, for any adjustment to metrics or school operations. The decision framework must include at a minimum consensus set of metrics to guide movement between red, yellow, and green, must include West data case data as part of the metric decision framework, notification timeframes for staff and parents given before a shift is made, and any school operational changes in the current pandemic plan, also called the fall reopening plan, for red, yellow, and green that are needed as a result of the decision-making framework. The committee shall include, at a minimum, but is not limited to, 2 current teachers, 1 representing the 40% who feel safe in in-person learning in red, and 1 representing the 60% who do not. 2 parents, 1 parent from the group that developed the alternative reopening plan, and 1 parent from the current virtual schoolhouse wait list. 2 physical health professionals, including 1 doctor and 1 mental health medical professional. 3 administrators from the principal impact team, 1 from each level of school, elementary, middle, and high school, and 2 board members, 1 from each side of the August 24th vote on how to reopen. The committee shall decide, once called together, when, how much, and how often to meet to accomplish the recommended outcomes, and district administration staff shall support the committee with the data and information requests. And that, Mr. Chairman, is my motion.
Is there a second?
I'll second for discussion.
Second is given. Is there any discussion? Seeing none?
Mr. Chairman?
Trustee Ozuna?
I would like some feedback from Dr. Reynolds on this, because I see this as a potentially good thing. If we have the medical community willing to come in, look at our plans, visit our buildings, talk to us about what's working, where our gaps are, what the risks are, and we have CDH support in operating in a hybrid, I think that's something we should look at, taking them up on their feedback to do that. I would like your feedback. I guess. Troy, can you shrink the font on this, just to allow me time to read it?
But I would tell you that we already have contacted health professionals, and I've already sent them the documents to review, so.
Trustee Newhoff?
Thank you, Mr. Chairman. While there's a lot in here that I support, I have a problem with this for 2 reasons. One is, it doesn't actually really in the end address what the agenda item was supposed to be about. We don't come to some conclusion about whether we're changing red or not. But my other problem is that it's a whole new thing that just got sprung on everyone, just like the administration's proposal. We suddenly see some new thing that we'd never seen before tonight. People want to say the board's in disarray. It's because of this kind of stuff where we don't have a chance. We're constantly changing things, and things change to the point that we're seeing 2 new proposals come at the board tonight that we have to consider. And personally, I don't see how we can consider either one of them when we just saw them tonight.
If I can speak, I haven't had a chance yet. For public disclosure, I did ask last night. I was asked to. There was some information that Trustee Johnson had provided. It's supposed to be board protocol to have it given to the chair to see if we can fit it into schedule. I have not seen this, so it's definitely a surprise for me. I think outcome. There's always 2 things, right? There's outcome, there's the end result that you can focus on, or you can focus on process. And to me, I'm always feeling that if we can focus on a good process, usually that always takes care of the end result. But this is shooting over everybody and shooting for the end result. And I appreciate your spirit. I do appreciate your logic you're putting into it. But suddenly everyone else is dismissed from the process. And that's the challenge I have, and I would struggle with voting yes on this.
Thank you, Mr. Chairman. Maybe I can address a couple of things. First of all, I cannot share a motion with the board prior to the meeting. Open meeting law does not allow me to do that. So I cannot do that. So I have to bring a motion to a meeting. Whether we decide to vote on a motion tonight is a board decision. But it does address, so first of all, adjustment of red per CDH recommendations is pretty broad. Our red category already allows for hybrid in red operations, and we approved that on the August 4th meeting. This motion continues and uses the hybrid operations for middle and high school and continues the plan for elementary operations for the next 2 weeks. So it's a 2-week decision. I did talk to Dr. Pate about this. I shared some data with him. I'm not going to say one way or the other. I didn't ask him to support or not. What I asked, was it reasonable, and he said yes. The other thing that I did, and I shared this with the chairman, I haven't shared it in front of the committee, or the board, although it is available, is look at the data. And really, I used the data that Dr. Rannells gave us for student and staff positive cases, and what percentage of the population was testing positive. And to date, there has been no notification to the board of outbreaks that have happened in our schools. And in that data, we've got 0.04% of our student population that has tested positive. And I'm really struggling to take away in-person learning when the data for our school system says something. It says is that our risk isn't as high as our community risk. Our community risk is higher. The other reason I'm struggling with the CDH recommendation is that it's 20 cases per 100,000 in Ada County and 30 cases per 100,000 in all other counties in CDH. That's not, how do you use that data when we're making it different by county and CDH? Additional struggle with CDH recommendation is they're still allowing bars to be open and movie theaters. These are things that are causing community spread that they're not taking action on to shut down. So I said, what do we need to look at? And I think our data is the right spot. But I'm one opinion, and I'd like some opinion from people on both sides of the aisle to come to some consensus instead of building continued distrust across our population. And that's the reasons for my motion.
So at this point, I'll call a vote.
I would like to speak if I could.
Please, yeah, Trustee.
Mr. Chairman, I'm feeling like I got, a lot of this is a big surprise to me. Number one, we didn't even have a physical copy of this report. Number two, we have a very complex motion. Parts of this I like a lot. I like the idea that we made a plan, and what we've been hearing from our constituents over and over again is, and this is from teachers, this is from parents. We heard from the teachers tonight. We've been getting a multitude of communication from parents in our emails too. The first thing I'm hearing is, please don't be adjusting things on the fly. And frankly, a district with 56 buildings and 38,000 students and 4,000 staff, it's really, really hard to say that if we approve something tonight, it's going to be implemented Monday. I think that we really need to give some advance notice. So I kind of like the idea that we need to, on the 28th, we need to have the plan ready, we need to have it out there, we need to have it vetted so that people are prepared to respond to it, so that we aren't doing things on the fly. Right now, we are in a hybrid mode that is not working very well. The teachers have told us they're stressed out. There are things about this that I like. I like the idea of the committee. I don't like the idea of saying they have to be from a percentage, because number one, how do we get that percentage? How do we know? You know, the one representing 40% and one representing the 60%. How do we do that? I'm not sure. But I just, I like the concept. I'm not sure I can support the actual motion. I'd like to see something maybe a little bit more simple. I think the idea of let's have something that's out there and vetted that we can absolutely approve on the 28th, because I think the end goal all of us want is we want our kids in school. That's what we want. How do we get there? And what I'm seeing is I'm not sure, because now we're talking about February. That's not acceptable to me. Thank you.
Thank you. Beg your pardon, I'm just, Dr. Reynolds wanted to jump in, I apologize.
And other school districts, all of those kinds of things. So the sense of urgency for us was when the category changed for CDH, when CDH said now West Ada, the Boise School District, and CUNA are in red. So that just, it happened on yesterday that I think we received that formal notification. The change in the classification definition happened last Wednesday. Was I think we listened to that panel discussion Tuesday night, and then I think the information came out on Wednesday. So the sense of urgency for us was in our original plan, was that when CDH placed us in the red category, that the transition would be to remote, to complete remote. But then when CDH changed their language a little bit, then that opened the door to continue the hybrid. And that certainly has been a good portion of the feedback, was could we just stay the same for a while longer? But we need more time to plan. So that's how we came up with that idea for the remote Monday. So I apologize that we felt like we had to hurry and make sure that we had something in place for Monday. So but it's up to the board. If you'd like to have us continue with elementary school going all day, every day, and have the secondary students continue in the alternate day, I mean, we can continue. That's up to the board. We can continue to do that until we need to go back through a broader process. So.
Any other comments or questions from the board? Trustee Ozuna?
And I think that I shared Trustee Johnson's concerns that we're not seeing the spread in our schools. At least what's been presented to the board, we're not seeing the spread in our schools. So it becomes very difficult to make a decision to put our kids back at home when it looks like, at least the information that the board has and what we're hearing from the medical community out there related to spread, that we are keeping our students and our staff safe today with the safety protocols. What does give me great concern are the emails that I'm getting about staff or administrators that do not wear their mask at all times or that do not put that enforcement out there. And I do think that as a district, those are, and you guys are getting the same emails that we're getting, so I know you're getting that information. But those are serious things that we need to look at. So, you know, I do struggle with, do we really need to step backwards at this time? Or can we bring in some medical experts that might be willing to work with us to determine whether or not it's safe for us to keep the kids in school? It is the best place for us to have our students right now, if we can keep them safe and keep our staff safe. The numbers don't show us, at least what we have been shown, that there's spread happening in our schools.
I just think we need to have that kind of back and forth. Is there any other discussion from the board before we vote? Dr. Rose?
I just want to reinforce what Trustee Ozina and Trustee Johnson have said. In those visits with the medical professionals, that's the one thing that has been said to me loudly, clearly, and strongly, that if everyone wants our kids to come back to school, then all of the adults have to stay home if they're sick, wear a mask, wash their hands, and practice. It's just speaking for the adults, that the adults are in control of their own social distancing. So I received some pretty good lectures this week on that. So I know in our schools, I think the kids are doing very well, but I don't know what they're doing when they leave us. I don't know about family barbecues and homecomings and those things we don't have any control over. But I do know that's a critical piece of our messaging and our plan in our, whether it's at the building level or the health and safety plan at the district level. So I do know that piece is important to all of us. But moving forward, again, we felt like we had to make sure that we had something that would stand the test of the previous plan and keep us moving forward. We were asked to put something together in terms of a timeline for 6 through 12. We're not asking the board to approve that part tonight. The question that we felt we had to answer was, now that we've been switched to the red category, do we need to transition back into complete remote, or because the changes occurred in CDH, could we continue the hybrid alternate day schedule with Monday being a remote day? So kindergarten through 12th grade, instead of going remote, kindergarten through 12th grade would have Monday as a remote day, and then Tuesday and Thursday would be team 1, and Wednesday and Friday would be team 2. But if the board feels that's too much, too soon, too new information, and you would like us to stay where we are for the next 2 weeks, I don't know.
So at this point, I think we probably should just call for the vote on this motion. So all those in favor, please say aye.
Aye.
All those against, please say no. No. Or nay. No. Those abstaining, please say abstain. Abstain. So we have 3 noes, 1 abstention, and a yes. And the motion fails. Is there another motion for item number 1? Any motions for item number 1? Do you have your, Trustee Johnson, did you intend to speak, or you just have your?
Oh.
Okay. Then item number 1 fails for no motion.
Mr. Chairman,
Trustee,
and I don't know the correct way to do this. There are parts of Trustee Johnson's motion I like.
that motion failed.
You know, I know, but I'm just trying to get a framework here. I think that we need to have some kind of a motion that we look at, number one, I think we need I don't like the idea of moving backwards, you know, because parents have to plan. The elementary schools, the word is out that we're moving forward with elementary schools. I think we should keep it there. And I you know, and here again, I don't know the correct way, and somebody that knows the procedure can help me a little bit. I want to at least put the brakes on so that we're not moving with anything else. But I do want to also say we've got to get something put together for 6 through 12. We've got to have a definite plan. And the other thing, we have to listen to our teachers. They're saying they can't handle this workload. So we have to move forward with something. So, you know, and that's where I am there. But let's consider the next motion, and then we can have another one.
Okay. Well, we're not going to have another one. We have one more motion on the docket. So we'll move on to item number 2, which is modification of yellow operational schedule. So do I have a motion?
Mr. Chairman, I have a question before a motion. If we don't make a motion on the last action, does that mean we continue in current operations?
That's correct.
Okay, thank you. I have a motion for modification of yellow operation schedule that I will start with. I move that the superintendent request the student achievement curriculum director and the assistant superintendent of teaching and learning to lead a work group to develop a plan to improve district-wide remote education.
I hate to interrupt you, but would somebody mind putting up I'm assuming you have another
It's on the same one. You can just
Okay,
scroll
thank
down.
you.
Yeah, sorry. I don't know where I left off. To improve district-wide remote education with the intent to achieve the same level of quality as in-person learning for West Ada students. The plan is not limited to, but should include at a minimum, remote education standards for all levels of students, target learning outcomes and metrics, training, prep time, scheduling, plan changes needed, additional classroom resources and supplies needed, additional technology needs, and rollout schedule to execute and be ready to meet the standards. The work group shall include, but is not limited to, and I put this language, I changed it from what Superintendent Randall saw earlier based on Mr. Heller's discussion about a work group already created. So the work group shall include, but is not limited to, 2 parents, 1 from elementary and 1 from secondary levels, with priority for selection given to parents that have expertise in technology fields. 3 administrators from the principal impact team, 1 from elementary, 1 from middle, and 1 from high school. And 2 teacher volunteers, if there are any volunteers, 1 from elementary and 1 from secondary, currently teaching or previously having taught synchronous learning this school year. The recommendation shall be delivered to the board at October 28th for review and board action. And Mr. Chairman, if I get a second, I will explain the motion.
Do I have a second?
Second for discussion.
Trustee Ozuna has a second. Any discussion?
Well, let me explain the motion so people can understand the why, because I think that's always helpful in the motion. First of all, I think it's very clear relief is needed for prep time. Like that's been clear for, I don't know, since we started school. I mean, frankly, when we decided to get rid of all of the days in the school year, I had doubts at that time that it was a good decision, and it's been confirmed over and over that was not a good decision. So we got to get that solved. The challenge is that that doesn't really solve the problem. And so I'm more than amenable to the yellow schedule change, but I would like it to come with a plan. And so this motion actually asks for that to come with it. So that's all.
Is there any other discussion? Trustee Newhoff?
Question for the motion maker. I don't actually see in the motion where it addresses the Monday.
It doesn't yet. It delays the decision until 2 weeks.
Any other discussion? Trustee? Okay. All those in favor, then we'll move for the vote. All those in favor, please say aye.
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 All those say against, please say no. No for me. All those abstaining, please say abstain. The motion passes 3 with 1 abstention and 1 no. That brings us to the end of this section. We're going to go into the executive session, and that'll be, we'll need a voice vote. And so the motion for the going into executive session will need to repeat the item, or the language as presented. So do I have a motion?
Mr. Chairman,
Trustee Newhoff.
I move per Idaho Code 74206-1B to consider the evaluation, dismissal, or disciplining of, or hear complaints or charges brought against a public officer, employee, staff member, individual agent, or public school student.
Thank you for that motion. Is there a second?
Second.
Trustee? Yeah, we have a second, thank you. We'll start with the voice vote from Trustee Johnson.
Aye.
Trustee Ozuna?
Aye.
Trustee Newhoff?
Aye.
Steve?
Trustee Smiley votes aye.
Trustee Smiley, I apologize. And Chairman is aye as well, so it's unanimous. We'll be moving into executive session at this time, and the record is 9:56. Okay, it's 10:12. We are out of executive session, and we have an item in our action under Section F. Would someone be willing to read the full motion as is presented and make that motion? Trustee Smiley?
Mr. Chairman, as per 42061B, to consider the evaluation, dismissal, and disciplining of hear complaints or charges brought against a public officer, employee, staff member, or individual agent, or public school student, that the board ratify the action of the superintendent to place employee B on paid administrative leave.
Thank you for that motion. Is there a second? Trustee Ozuna with the second. Is there, we'll have to go through a voice vote. Trustee Johnson? Trustee Johnson for the voice vote?
Mr. Chairman, I abstain.
Abstention? Trustee Ozuna?
Aye.
Trustee Newhoff?
Aye.
Trustee Smiley?
Aye.
And Chairman is aye, so it passes 4 with 1 abstention. And then item 3, information, future agenda items. I don't know if Dr. Reynolds has anything she would like to present.
Mr. Chairman, I move we adjourn.
We are not at that level yet.
You have to accept in part Robert's Rules of Order a moment. It's not debatable.
I am
motion
not
to
going
adjourn.
to do that right now, okay? Now we have information. Dr. Reynolds is speaking.
It's not on the agenda, Mr. Chairman.
Information and future agenda items is right there. It's item 3. So Dr. Reynolds, did you have anything you'd like to make?
Thank you, Chairman. I was just wondering, the motion that was made, may I ask the clerk a question?
Please.
Did we get the wording of that, so? Yes, the motion that the board passed. I just want to make sure because,
Dr. Reynolds, I gave it to Troy.
okay.
Yes.
I might need some help.
I'm happy to help in any way I can.
I'm sure. So we're moving then to item 4, adjournment. Do I have a motion? Trustee Ozuna?
Mr. Chairman, on future agenda items, there's a lot of activity in our action portion of our agenda tonight, and it might make sense for us to consider a follow-up meeting. I do think that the newness of the plan change, I was very prepared for the documents that we were given prior to what was presented tonight with the plan. It might make sense for us to have another meeting quicker to have another discussion, just consideration. Along with that, I also think that, we have some real risk with technology that we do need to talk about once the district's had a chance to talk to Mr. DeLashman, and also potentially some legal follow-up related to what our risk is in operating in red. So it might make sense for us to come back. Thank you for your consideration.
Thank you. Just so I'm clear, you're basically saying that you would like to have a midweek, maybe next week or earlier, even Thursday.
I'm saying it may be helpful for us to have a follow-up meeting as soon as possible.
Okay.
To rediscuss actions related to technology, legal, and to really give us some time to look at what we were presented with tonight.
Mm-hmm. Excellent. Okay.
Which we might have wanted to take just a pause in general.
Gotcha. Okay.
Thank you.
Very good. Thank you. So move on to the adjournment. Do I have a motion? Thank you very much, Trustee Ozuna. Is there a second?
Second.
Trustee Smiley with the second. Before we adjourn, I can't continue like this. This is ridiculous. And I'm sorry, but I can't have another, to be very frank, I've risked my business, I've risked my family, the internal conflicts that I've had, through the time investment that I've had, and I can't get a phone call that there's an emergency, some sort of surprise, obviously I'm not a leader here, and it's a shame, but I find that I feel that that obviously that the board does not appreciate the work that I'm doing, and it would prefer to work by yourselves. And so I give that back to you. So at this evening, I resign as chairman of the board. It's adjourned.
To adjourn. Yep, so you have to, yep.
Okay, there is a motion and a second to adjourn. All in favor, please say aye.
Aye.
Aye. We are adjourned.